shit. Well, that didn't work. I don't know what the fuck just happened. Don't really need to be dealing with this shit right now, though. I know that much. Kind of got me hanging up here. Computer's about to fucking blow up. Thanks. I don't know what just happened. Prism strong arming me, so I buy their premium edition. We'll see what happens again. They're like, oh yeah, you don't want to. I did their trial. That's why the Prism shit wasn't at the bottom of the screen. And now I don't have the trial anymore, so I'm not a paying Prism customer. And I don't know what just happened. The app is closed by itself. I think. Hey. Yeah, that might happen again because I don't know why it happened. I for a second thought the phone had died. What are we doing? What are we doing here? That threw me all off though. I really probably more than anything to go ahead and give Simon his methimazole. Because there's something about me pilling him that makes him want to eat more. Oh hush. They all ate at 3 in the morning. Normally it's 1:30, so they ate an hour and a half late. So the thing I'm getting at is she's alright. I could be late as fuck today. All the medicine's down off of the silverfish container. Starting all over again. The Filamazole, 2.5 milligrams. Check. Weighing it at 99. Weighing it at 100 milligrams and 99 of 100. That's what it's supposed to be. Now we need 1/4 of another 100 milligram size pill, and that'll give it another 1.25 milligrams additionally. That is weighing out at 0.025, 0.026, 0.025, and that is what you want to see, folks. I already had that one split from yesterday. I had a good split. I had a good split yesterday. Put that in the pill pocket. My little quarter. Get my 2.5 milligram sugar-coated pink little cute little. Look at how cute it is. Look at it. And there's my quarter. Wee, look at me, I'm important too. You are important too, little guy. There you go. You guys can be important together. Yes, make love. Yeah, you're gonna love each other. You snuggle. Snuggle up in there. You guys, stop it. Okay, there it is. You still want to come out. Get in there. Alright, that's better. Dude, where the hell was fluffy yet, though. All right, got it. Bop, bop. Let's go put this in his mouth. Hey, buddy. Hey, buddy. You want to eat that? You want to just eat it on your own? Yeah, of course. You want to eat it? Okay, you're gonna make me eat it. You're gonna make me put it in. Okay. Oh, no. I see what you're doing. Good job. What do you got here? Ow. Sorry. See what I mean? He oftentimes eats after I pill him. He went back to it twice that time. Like he went to the fluids and he went back to the food. He went to the fluids, he went to the food. Well, all right there, buddy. Look at the blinds. Tell me what you think. Look, we got these two. They're dirty, huh? Gotta mix these two up a little bit. We're almost done with this whole silly mixing thing. I don't even think I need to do it anymore. See, 15. See how long that takes for me to get rid of this if I do 15 every time. Too long. Let's see, let's get in 21 of it. 21 grams. That's the Purina Pro Kitten Chicken, grain-free. Now we're gonna give in the remainder of his grammage in Fancy Feast. And we're gonna reduce them to 55 grams rather than the 65 I've been given. They're 56, 56. We'll go with that. Yeah. Always leaving some on the bowl, so I must be overfeeding him. We're gonna crank that back a little bit. Also got to remember to give Simon furosemide. The bot seems to think I should give him the full 10. I really wish I could get his resting and respiration rate without it.
Doing Sammy.
Damn it, man. I haven't even given him half a can yet. Now it's half a can. Okay. So this will put him at 1.5 cans total. As long as he can hit 2.5 cans for the day, he's doing alright. I've given 0 stimulant for appetite. Let's heat this up for him. That's at power level 5, so it's like 56% power for 15 seconds. For a size about that big, the set room temperature brings it up to about 98 degrees. Oh, it does have some hot spots around 109, 108, but that's still, let's put that a little bit. I mean, that's not like I'm burning. The cat's temperature is higher than ours, so. You're good. He's not coming here. He is not coming here. No. I'm falling over. She's already almost done. I forgot to cut the grass. So Trident is not here today. I don't see her. Shiloh or Trident. Hope they're doing all right. Oh, you're all done? You're all done already? You're such a fast eater. I give her the same exact amount of food. Well, pretty much same exact. I don't weigh her, I didn't weigh hers out, but it's close to it. And look, he's still got that much left. And he's a kitten. So maybe I could still be giving him too much food. Am I still giving you too much, dude? He didn't eat all of it. Like, I'm surprised he didn't lick it clean like Sweet Pea did. Like, she wants more, you can tell by that bowl. Look. Oh, there he goes. Okay. Okay, that's what I'm talking about. Waste not, want not. Oh my God, I need to vacuum, dude. Oh, I need to vacuum. There's litter everywhere, y'all. Man, why can't y'all keep this shit out from all over the place? Here, take it. I can let you out now. You finished. Come on. No, you're gonna be bugging Simon. But go on. Go on. Don't bug Simon. How long do you think it's gonna be till we hear Simon pissed off? Oh fuck! He's licking her bowl clean. He didn't even really lick his bowl clean, bro. You're a weirdo. There's nothing there but spit. What are you doing? You weirdo. Oh yeah, nice stretch. Don't go back to it. He wants more of it, whatever that was. The juices. All right, y'all. Go have fun. Dude, Simon hasn't slept all day and morning so that I can get a rest and respiration rate on him. So he's not hypothyroidic. I just dumped a bunch of litter on the ground. On the carpet. Because if you're hypothyroidic, you would be sleepy. So, man, I wonder if he's still hyperthyroidic. I try not to breathe very much when I'm doing this shit. So that I'm not inhaling what the cat does. Cat pee does. Hey, you haven't bugged Simon, that's amazing. Or have you? Maybe you have. Is that why you're over here already? Do 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 do. Hey, fucker. Ain't nothing over there should you be fucking clawing on it. Dude, Simon has like put out as much weight as both of them combined for the past 24 hours. Oh my God. I'll tell the bot that and see if it still thinks I should keep giving him the what's mine? Is it still a good sign, you fucking bot? Let's find out. Well, let's find out. See, look. I got proof. Actually, yeah. It's about as much as the kittens produced, or the other cats produced together. Outstanding signs, it says even. Urine output matching two 9.5 pound cats combined. Confirms peak furosemide success without dehydration. Ideal for CHF control, excess fluid cleared, matches saliva gums. Alright, dude, so it says give him the fucking. It says give it to him now, 10 milligrams furosemide. Alright. It's just that I'm burning through. I'm gonna try to use one of the manufacturer ones. Cause I'm burning through them. Use one of the ones that are made by a pharmaceutical company. So B2, 40, 45, Why isn't it equal? Shit, man. Why can't they just be equal? Try it again. Try it. Got me splitting again, man. Those are even worse off. get Simon out of there. Out first. Big pill, big pill. Good job. Good job. 10 milligrams for somebody. Boom, boom. We were doing the right thing, Simon. See what his sitting up respiration rate is right now. 1, 2, 3, 4, 5, 6, 7. If they multiply that, it would have been 21. It would have been 42 total because he was at 720. One, 2, 3, 4, 5. God damn it, Simon. What are you fucking doing, man? Idiot. I swear, dude. See what the fuck cat's back there now. The only cat back there is Penelope. It's weird, she's squinting like she got in a fight. I wonder, dude, where the hell's Fluffy at, man? So weird. If that's the case, I can just give her food. I saved Simon's food from yesterday. Frank, I'm not so poor that I can't give the outdoor cats fresh food at least. I mean, it hasn't been chewed on before. So we're giving her half a can. Oh, throw it in there, right there. Boom, boom. Right there. Throw it right there, buddy. Why is there extra in here? Whatever. Early bird gets the worm. Dude, I bet Frank's gonna show up though right now. He has a tendency of being a late shower. Oh, dude, he showed up yesterday at like 10 something. That's annoying. I don't know, man. I don't know where that fight happened. It was under the house. It sounded like it was. For a second, I thought it was in the neighbors. But... Okay, we got the heat on high. Time to cut that shit down. Go check one more time. I'm sure Frank's not back there. No Frank. No Frank. No Frank. No Frank. No Frank. Where's Frank? Where's Frank? Only Penelope. Penelope's going to be our last customer. Unless, of course. Unless someone shows up late. Then I'm obligated to feed them too. Come here, Simon. You gotta put you up now. Come here, We're flying together. Get on in there. Be on some of their dome. See, what do I need? 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 I'm going for it. Oh, yeah, I know what I need. 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 I need my little spritz. I need to be able to spray somebody. Alright. Now I got that. Well, all right then. Penelope fed, recycling bin in. I probably heard the recycling bin. You can hear everything. Cause these walls are super thin. Oh, baby. Baby, baby. Jazzy, jazzy. Adoration. The hover round, there's the hover round. You know, a jazzy one, too. Jazzy. All right, here we go. Wow, looks like my plan is working, like with feeding them a little bit less. Maybe they're finding another place to eat. And that's what I wanted to happen. Because this, like, we're going to stay up in Elfie. You guys such a bond to this place. I mean, maybe he knows the sweet pea is here. So. Right now, we're going to let Simon back out. Hopefully he wants out. He probably wants out to go sniffing around. Simon! Simon, come here. Simon, come here. Simon. Broski. See you in there. Hang on. There he is. Come here, buddy. Simon. Got 30 minutes to eat. Simon, what are you doing? There's nobody out there. Go, you're free. Yay! You gotta run. You gotta run. I'm gonna get you. No. You're getting fat, baby. Damn, I let the gate slam. No, you can't have that toy. Here, you want? Go get it. Go get it. Oh my gosh, he fell. He's not used to it being slippery. Come here. I'm sorry you fell, baby. Oh, I'm sorry. You ready? You ready? Look. Go get it. No. Are you ready? Go. No. Go. We're getting a workout. No. Are you ready? Go. No, stop. I'm gonna get you. No. You gotta lose some weight, sweet pea. Yeah, look at this. No. I win the water. Dude, I'm getting the fucking workout. I'm gonna get you. Are you tired? Gotta go back in. There you go. Right, Simon wants out. No, baby. I'm sorry. Simon's gotta eat, baby. He's gotta eat. Let's see if he goes. What are you looking at me for, man? So we're thinking the same thing. Oh, really? already, dude? What are you, Simon? Bro, we had a good thing going there. She's just going around. You want to go in there? No? Uh-oh, you about to fall over, bro. What's that? Guess we're going in there in a minute. I gotta get some food. No, you get too crazy with this, sweet pea. Scared that she's gonna rip it open and start eating it. I know you can get that from there. I know you can do it. You're gonna let Sawyer get it for you? There it is. Oh, you almost got it. You almost got it. You got the fingernails, girl. Don't you? I thought she'd be able to grab it. I'm not trying to torture her over here. She ain't gonna let him have that now. See, she's going off and hiding with it. You're gonna be chewing the hell out of it. She acts like that's a real mouse. She's over there growling and shit. That's weird with this thing. Watch if I touch her, but she growls. I'm gonna get it. We're gonna get it, sweet pea. We're gonna get it. We're gonna get it. We're gonna get it. We're gonna get it. Yes, silly. No, I got it. Oh, I got it from you. Oh, she just doesn't want him to have it. You can't play with that one, bud. Oh, he's going though anyway. I can hear her chewing on it. She went and hid. You went and hid back there. Oh, there you are. Why are you hiding from me? There. She treats it like it's really. Yeah, she just shook it right. I think maybe she hunted mice when she was really young. She definitely acts the most feral out of all the cats I have. Like, she acts like she's still got. Some people say that feral is a breed, and they'll always be a little bit feral. Cause I got her super young, man. 5 weeks. Like, I should have been able to deferal her, but she still got like a little wild to her. Wow, dang. Dun, dun, dun. Cutie, why are you playing right there? You all up in the cut in there. She's like, don't watch me. catsThis. She really likes that toy, doesn't she? There are a few toys that she'll just like play with like this by herself. Oh my gosh, you came out too fast. Baby! God damn, she hurt herself. Baby, come here. Come here. Oh, she hurt her neck. She came out, didn't realize that thing was in the way or something. Oh, come on, sweet. Why you gotta hide it? Why are you fucking hiding over here in the corner with your toy? Why are you doing that? Huh? What are you ashamed of? So we gotta go hide and eat it? I gotta watch her, man. She eats weird shit. That's why I had it out in the hallway like that, away from her, because I was worried. I'll find toys like soaking wet because she's been chewing on them for like half an hour straight. Those are the ones I gotta put outside. Where's Simon at? On the couch. Stop looking at me, Muhammad. See, that's proof that I'm not like a white supremacist, racist dude. I have a fucking picture of Muhammad Ali looking down on me every day like I'm a piece of shit. More minutes, Simon. He's really slacking on the food eating today. Hopefully we make up for it at lunchtime at 1:30 because I'm pretty sure I'm only half a can in here. Yeah. And this is fucking damn near half a can sitting here. So he's been fucking with me this morning. Like, just, look, he's pretending a little bit. I'm just playing when I say he's fucking with me. I know he's not just doing it to fuck with me, but he's fucking with me for sure. Nonetheless, I am being fucked with by the cats. Give it a little push, give it a little stir, give it a little heat. Give it a little mush, give it a little stir, give it a little heat, give it a little mush, give it a little stir, give it a little heat, give it a little mush. Oh, that's just lovely. Oh yeah, that's where it's at. Give it a little mush, give it a little stir, give it a little mush, give it a little stir, give it a little heat, give it a little mush, give it a little stir. I was just playing. I don't know if that actually marks me safe. No. Oh, come on. You've gained a little weight though, baby. Come here, let's see what you got. Let's see what you Show me what you got. 9.5. 9.5 again. 9.5 again. All right. I mean, he's got 7 more minutes. At least his weight isn't going down. I'm surprised that the furosemide isn't making him more thirsty so that he'll eat more, or at least drink more of the hydrocare. he still acts with a pep in his step. He just kind of like hurriedly ran in the hallway right here. So I don't think he's going hypothyretic yet by the increase in dosage that we're giving him with the added quarter tablet, or 1.25 milligrams methimazole. Hey, buddy. I'm a scientist. What's up? Verbalization or vocalization. That's interesting. I didn't give him an appetite stimulant today to make me think that that's what's doing it. You good, buddy? We're getting rid of water. If it's on his lungs, we're getting rid of it, and that's why he's got all this extra urine output without the added input. And where else is the water coming from? Right? It's got to come from somewhere. It can't just come from thin air. So we must have water in there that he's getting rid of. Maybe it'll get better. It's increased dosage regimen. If it weren't for the AI giving me reassurance, I'd possibly still be waiting on my vet to get in touch with me. You know, I'd have probably called him and bugged the hell out of him, but I'd be pissed off about it. Simon's sitting right here. We heard him meow. He's just been sitting right here the whole time. Wrong button. This is the one that Costco has right now that I was very tempted to get one of. Toasted Barrel Jack Daniels. You know, I'm from Tennessee, so it was calling to me. I was like, it's meant to be. It's what I relapsed with last time, remember? Well, not this one. It was a single barrel. It was actually this one right here. Jack Daniel's Single Barrel Rye is what it was, because I hadn't tried it yet. And if I hadn't tried this Heritage, man, I might have broken on that one. I broke on this. It was 68.8% when I got off the wagon last time. I went straight from nothing for like 4 or 5 months to 68.8. Boom! What was I doing? Yeah, I got bottles, baby. I got bottles on bottles on bottles. There's actually, believe it or not, a market for used liquor bottles. So I kept them just in case, like, anything happened with the, with my ability to pay the rent. I could sell bottles if I really have to. So it's not, I'm not really hoarding them, but I am. But they have a purpose. I would get really fucking, like these right here. These are worth even more because they're handmade, they're hand blown in Mexico, and they're hard to get. The tops are hand painted, and people make lamps out of them and shit. Fortaleza, it's really hard to kilo to come by, but I have like 6 of them over here, or no, 5 of them sitting over here. The other ones are super dusty too. Look at this shit. They all need to be wiped down, but they're probably worth like maybe 10 to 20 bucks each. How much was what? He thinks you're talking, but doesn't want to walk away. Oh, that's a good point. Look at him now. You see him back here? What are you doing, Brooklyn? You checking it out? Oh, you checking the bottles out that I just put down. See, this is also not hypothyroidic, so maybe he still needs more hypothyroid medicine or methimazole. He's acting very inquisitive, he's a little energetic. Maybe this is his old self and he's in the mid-ground, he's where he needs to be. But still skinny. He's so skinny. He's got to gain some weight on me. Can you gain some weight for me? Your heart's too big, Simon. His heart's been big for a long time now. Like 3 years, he's had a really big heart. Who knows how long it was big before that? Before they finally tested it. He's really going at it over here. He's rubbing his chin into the corner of the box. Look at that dexterity that you got going on there. Okay. Time we got, we're 1 minute past, but I'll let him eat if he's wanting it. Go on, get some more, buddy. Come on. No. Simon, come here. You want some more? I'm gonna pick it up. Some more bucket it up. Nothing, huh? All right. Yeah. Okay, he's eating about 1 1/4 cans. Man, damn it. He was almost at 2 cans of it. Maybe he was just so deficient that he felt the need to really gulp it down. He'd been in a calorie deficit for so long. I'm supposed to take his respiration rate soon, but oh, there he is. He finally sat down. 2, 3. Damn, it's 44 still. I'm getting 44, 22 doubled. Like he's almost constantly breathing this fast. Yours don't feel hot. This one feels warm, but this one feels kind of cool. Left ear only. I wonder what that means. Let me see if that means anything. Oh, cats only left ear feels cool. Let's see. Simon's left ear feels cool, but right ear is warm. Awake, comfortable, respiration rate 44. Simon's left ear cool, right ear warm, plus 44 BPM, awake, comfortable, post forest, like 1 hour. Wait, what time did I give it to him? No, it was more like, yeah, it was roughly an hour ago. It's just mild asymmetric perfusion from congestive heart failure, low output, not alarming, isolated, but monitor with urine and weight gains. Cool extremities common in heart failure, poor circulation, prioritize core, asymmetric possible from position or sotalol rhythm. Or sotalol. Dude, I've been thinking that sotalol's been making him sick, dude. And there's no way for me to test it without just holding it. I can't split it. I could try doing like a one a day, but it keeps advising me not to do that. Not urgent if gums, pink, moist, saliva. I need to know if he's got saliva in his mouth. Okay, sorry to do this to you, Simon. Let me clip my fingernail first. do all of them real fast because I've been meaning to do that. I've been putting it off taking care of cats. And yesterday, yesterday got in the way because when I was tearing up the boxes at the Sumo oranges, I fucking bent a couple of them backwards. It's like, ow. They snap right back though. I have resilient fingernails. Probably because I take calcium every day, maybe, I don't know. My fingernails. Do fingernails have calcium? Or does, calcium input affect fingernail generation? Okay, here he's back. Back again. Simon's back. Tell a friend. We have moisture, and that's all we care about, right? As long as there is moisture in mouth, kidneys are good. Question mark? Moisture, saliva inside his mouth is a good dehydration check, but not a direct kidney function test. It indicates adequate hydration. Dry, tacky equals dehydrated. The kidneys need blood work. As Rosemary stresses them, even with wet mouth, urine output. Okay, CHF hysteretic equals azotemia risk despite signs. I need to see his gums also. Is that blue? How do they do it so easily? I don't know, man, if that's blue or not. You're always really hard for me to do that too. See? Let's try it again. They do look like pink though, if nothing else. They're not like blue, but I kind of want to look, see if we can get more light on them. Oh, God. They do look pretty white. They look whitish. I'll just tell that the gums look whitish. Shit, it's gonna say that's bad. Whitish. Oh no. Red flag indicates poor perfusion, shock, low blood flow, oxygen, common for asthma complication or CHF progression, especially 44 weight. Cool ear, massive urine, possible overdorosis. Urgent veterinary care now. You motherfucker. And now it's saying it could be dehydration, advanced dehydration, because he's still got saliva. You and motherfucker. Bilateral pill equals crisis. There is like a bilateralness to it. But he's acting cool. Okay, so, but he's acting normal. Oh, he's chewing on his back legs though. That's a bad sign. Oh, man, what's going on, dude? Are you good? They can get deep vein thrombosis in their artery in their legs, and all of a sudden not be able to walk and shit from a man. Dude, he's acting itchy. Oh man, come on, bro. What are we doing? What are we doing, Simon? Can we sleep sometime soon so we can get that resting respiration right? What are we doing, buddy? It's really bothered. I don't know. What a dick. I've never been like a I just recently started looking at his gums, so I've never verified what the vet what like his different gum colors and if it's a big deal or not. Like it might not even be a big deal. Maybe we'd be in his office and the vet would be like, "Oh no, his gums are fine," like that. But I've just recently started looking at him, so I don't really know. I didn't know that was a thing, dude. Look at their gums. You better not be dehydrated. I drink your water, buddy. You gotta drink your Ovaltine. Hey, look at this. You want some more of this? Oh, fuck, I'm making a mess. Num num. Num 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 num. Good for you, Simon. It's like kitty Gatorade. Hydrocare by Purina. It's made in France, dude. It's pretty fancy. I'm not even bullshitting. Why it's made in France? I don't know why. Why? I don't know. It's kind of weird. Maybe they have all the livers. They have all the livers, man. They have all the extra livers. Yeah? Want some more? Come on in. Come on in, Simon. Have some more. Have a little more? Yeah, have some more. Let's have a couple of licks. One herb. Two for the road. Two more for the road. Come on, you got it. It's right there in front of you. Heck yeah, go on and get some. There it is. Couple more. Oh, you fucker. You fucking with me, Simon. What are you doing? So, you'll be walking around. Yeah, oh, I said something like he's acting normal. Let's see what this thing says. Even if Simon's acting normal, whitish pale gums remain veterinary emergency in CHF cats. Cats expertly mask severe illness, which is anemia, hypoperfusion, shock from frozen wing, over diuresis, and abnormal behavior delays care until collapse. With cool ear, plus 44 ppm, plus massive urine, this screams low output anemia. Huh. Okay, let me just ask you if the sotalol could be causing this. CHF cat's high pain till end stage. Pale gums equals oxygen starvation despite eating and relaxing. Risk blood loss. Plavix. CKD flare. Arrhythmia. Sotalol. Wait, you just mentioned sotalol. Why are you mentioning sotalol? What if it's going to say he needs more or less? I mentioned sotalol because Simon is on 5 milligrams twice daily for arrhythmia control, post-December 2025 ECHO, part of the CHF polypharmacy with pumabendan furosemide methimazole plavix. Pale gums plus cool air could signal sotalol overdose. Very interesting. Bradycardia, low output, or interaction, especially with furosemide electrolyte drain. This low K plus or potassium history, normal behavior hides it. Sotalol link. Oh, sorry. You're looking at nothing. Beta blocker slows heart. Pale gums equals poor perfusion possibly. Full list. Pumabendan 1.7 milligram sotalol. Emergency call 6. Wait, hold up. What? Maybe I should hold next sotalol dose. Dude, I really don't want to have to go to the vet again. Why did I don't know how they would check this. Do not hold the next sotalol dose on your own. Pale gum anesthesia could be worsening heart failure than your ARB or furosemide, not sotalol overdose, which causes bradycardia. Abrupt stop, risk rebound, arrhythmia, or death. Taper only under bed. It says pale gums more likely CHF progression because of the cool ear perfusion, or Plavix bleed. Plavix bleed? What do you mean, Plavix? Internal Plavix bleed or something? Assessing potential Plavix-related bleeding risks. Plavix bleed is possible but rare. Pale gums could be subtle hemorrhage, bruising, gums, nosebleed. Tarry stool or coffee vomit, amplified by furosemide platelet effects, explaining a whitish look despite normal behavior. Simon's aortic thromboembolism risk justifies Plavix, but monitor. Michael, hey man. I think I need to eat something so I can think straight. I wish you would fall asleep though. What do you want tonight? don't know why that Margaritaville song keeps going through my head. I don't even listen to Jimmy Buffett. There's so many variables, bro. That's the thing with this, with Simon. There's just so many damn variables. I think vets like for the patients to be on as many shit as possible, because then it makes it so much harder for the owner to fine tune things. What am I gonna do? Hmm. 11 million subscribers. What do you mean? Oh, cool one. Asked how would we know if it's a Sotal? To know if Sotal is causing sinus pale gums, cool ear and respiration rate high, vets check these. Heart or pulse rate needs to be below 120 or one. Oh no, if it's below 120 or 140, it's bad. Primary sign is lethargy and collapse. ECG or Holter monitor. That sounds expensive. Blood pressure. I wonder if I can buy one of those. That are accurate. Low K worsens Sotal. Huh? A blood test would rule out a internal bleed. I think I need to buy one of those blood pressure kits. $500. Yeah. Yeah. Wish I had that. Doppler blood pressure system. Whoa, that was expensive. Simon, go to sleep, bro. He's still just walking around. Oh no. Man, fuck. This isn't good that he's not resting. This is now saying that me delaying going to the bed could be fatal for Simon. And now he's laying down, ready to go to sleep. And it doesn't say could be, it says delay, fatal. Could y'all see it all? I don't know. I can't. It's hard to tell, man, if they're white or light pink, or I don't really know what the fuck they're supposed to look like. He's breathing way too fast. Imagine having to breathe that fast while sleeping all the time. It never slows down, really, it seems. His mouth's a little open. He's open mouth breathing, actually. I think that's considered open mouth breathing, even though it's not like panting. Trying to see if it's actually open by seeing if I can feel air coming out of it. That's all the way closed. Yeah, I found Simon on the sidewalk when he was like, I don't know, a couple months maybe, a couple months old. He's almost 16. need to know if his pulse is low. And I think the gabapentin fucked with that. They couldn't tell for sure whether Sotalol was what caused his pulse to be low. Fuck. Look at something. Does or could the 0.75 milligrams, no, 75 milligrams gabapentin have lowered heart rate during think it fuck can lower heart rate. Studies show single oral dose drop of 10 to 20 beats per minute and blood pressure 12 to 40. Okay. Could the wait. Would a vet would he have been able to see it without doing a blood? Vets can detect high Sotalol via physical exam, but blood work, urine alone insufficient. It requires clinic test, heart rate, ECG, or BP, not home. Alright, but it says Sotalol overdose equals collapse or lethargy. So more than likely CHF or anemia or anemia. So heart disease or heart failure or anemia is saying more likely equals if pill gums are normal. The last vet visit only included those things, and they increased glucosamine and gave type. That's what people are hearing. Could miss high Sotalol if no ECG or heart rate. No, heart rate was measured. heart rate was measured last visit and deemed safe, likely 120 to 180 BPM on Sotalol. No bradycardia. I already did a lot of work for this dude yesterday. I weed whacked the alley already. Dude, I love my I have an electric weed whacker. I love not having to deal with maintenance on that thing. I'm looking at all the like the oil and shit that's gunked up on the side of that thing. If you got it. Ooh, that was my chest, dude. They didn't see overdose then. Physical exam catches slow heart rate, but might they have mistaken his slow heart rate for gabapentin effects? It's saying unlikely vets mistook slow heart rate for gabapentin. Gabapentin causes minimal heart rate drops, 15 BPM sedation. Safe if CHF cats, while Sotalol targets 120 to 180 BPM control. Clinicians differentiate by timing context. Gabapentin PM, Sotalol BID. No, but gabapentin was AM. What are you talking about? Gabapentin, no. I gave 75 mg gabapentin 1 hour. I'm gonna put 1.45 hours before testing him. Yow. 75 milligrams gabapentin, higher sedation dose, still minimal HR impact. Studies show 50 to 100 milligrams, HR 10 to 20 BPM transient, HR drop 10 to 20 BPM, breaths per minute, but unlikely mistaken for Sotalol overdose. Vets expect combo target Sotalol 120 to 180 BPM regardless. Gabapentin peak, 1 to 2 hour sedation, HR recovers quick, heart rate recovers quick. Sotalol steady, BID dosing. ECG distinguishes arrhythmia control versus excess. ECG, how much is that? Fuck. CHF cats often get gabapentin safely pre-exam. They wouldn't ignore true bradycardia. Pilgrims cooler persists post gabapentin or perfusion. Call vet now. Call vet now. Just give me phone numbers to some vet. I don't even know what vet that is, dude. It's like, call this number right now. Call fix. So how much does this cost? How much cost? $100 to $300. Oh wait. Often bundled in exam and wellness, so it'd be $400 to $800 as it's saying now for full rhythm analysis. And This is telling me there's a place around here that will do it for only 180. It's the one that keeps giving me the number 2. And maybe that's the next vet I call up. Man, oh man, boy. Is Simon sleeping yet? I don't think he takes it. No, I don't take it. I do not take it. The cat takes it. Big ups. And I didn't give it to him today. Got before his vet visit.
That's not.
So I don't know why he's sleepy. It's good that he's sleepy though, I guess. Okay, let me let the bot know. This is saying he needs his emergency room oxygen if his respiration's over 35 while asleep. Is that right? I wish I had something else I'd take is like another timer. Man, I need another timer besides his phone. Amen. Shit. Damn, he opened his eyes. Buddy, how am I ever going to get your rest and respiration rate to keep waking up? One, two, three, four, five, six, seven, 18, so that puts him at 36. So he's awake though on his side, so that's good. I'll try one more time. Once it gets to 30 seconds for me, I need that to make it easier. One, two, three, four, five. I can't see it now. He's moving too much. I'm gonna tell the bot that. Let's see what it says. He's all over the place, man. So we'll put awake on side, comfortable, slight. Oh wait. Alright, let's put comfortable respiration rate 36. It's going to say it's the first of my working probably. The first one is hitting the breakthrough or something. Awake or rest of respiration 36 on-site comfortable is borderline elevated for heart failure cats. Ideally below 35 awake. Your history 28 to 48 BPM shows trend up from lows, but no GABA plus comfort equals stable-ish. Still flagged with pale, cold ears gone. Oh, just one ear was cool. The other ear was. Let me feel the ears again. It keeps bringing up the fucking ear. False alarm. Both ears are warm. Both. I put them up to my lips. Ears are warm. Do you know that if you want to know if something's wet or not, say like it's barely wet, and because you can't tell with your hands, maybe you can't see it or whatever. The best way, like a shirt, say you don't know if a shirt's dry or not when you're looking at when you're touching it with your hands because of the temperature that it is outside. The shirt's actually at like the same temperature, the room temperature, you know what I mean? So you use your lips to feel. Your lips have the most sensitive wet sensors to know if something's wet or not. I mean, it makes sense, right? And the reason why I know this is I was in a program when I was a kid, and this guy, we went to this thing, it was called like the farm event or something. We all went to this guy's property out in the middle of nowhere and did stuff like as a group. It wasn't just dudes, it was women too, or girls too. But what the fuck was that? Oh, we had to start a fire with something. Oh, and we had to dry out a pan with something for some whatever fucking reason. I can't remember what. We rubbed it in the pan too, but they were trying to tell us that the cow dung was actually like not dangerous, not poisonous, and you can tell whether or not it was wet or not, like ready to be used for different things, like for fire starter or whatever. You could tell by putting it up to your lips. And I'm still friends to this day. I haven't talked to him in years, but like if I gave him a shout out or shouted out to him, I probably would. But he was the guy that put it up to his lips to see if it was wet. Forget it. I wasn't putting the cow shit on my lips to see if it was wet or not. What the fuck? Y'all got me fucked up in here. Hell no. So I always remember that now to this day, like the lips are the most sensitive. So over less 35 home watch, 35 40 vet, call vet same day today. He's awake, dude. Awake over 30 isn't too big of a deal, motherfucker. Oh wait, I gotta tell it both ears warm. I haven't told it that. Boom. That's gonna change things, I bet. Both ears warm equals improved peripheral perfusion, good sign versus prior cool ear. With awake RR36, comfortable, overall stabilizing post furosemide. I knew it was gonna say that. I knew it was gonna say the furosemide. What's going on in there? I called it. Pale gums persist needing check. I don't know if they're actually. Let's look at give me multiple pale gum charts for felines and how to observe in-house. Salmon pink. What the fuck? Pale pink. It goes from salmon pink and then no action, and then all of them below that are like, you gotta talk to a doctor. Push up on the. I'm supposed to do it. I'm supposed to do it like this. Let's see about that. Is he still awake? He's still awake. Hey, buddy, we gotta try something. Are you ready? Are you ready to smile like the Joker? Oh, this is gonna work here. I'm gonna try it. What's going on with your foot? You want me to hold that for you? Oh, they look pink. They look pink. I'm sorry. They look pink. They look pink. Oh, they look pretty pink to me. Let me just see. I'm gonna punch in that maybe I'm mistaken and his gums actually are pink and see what it says. Because is that the main thing that it's concerned with now? Alright, okay, this says the gently lift upper lip, check 2 times a day for some color, press gums Oh, press the gums. Press gums for 2 seconds. Called blanching them. Release. Refill. 2 seconds. If they refill 2 seconds to pink, it's good. 2 seconds to pale. Pour. Oh, that's how you can tell whether or not they're pink or not, is by pressing on them. I see. I'll do that next time. I'm not going to bug him right now. Okay. Okay, the bot's teaching me now. Okay. Gotta press them. You gotta give it a little press, like when you got a sunburn. Ah, interesting. Yeah. Use a phone photo in that. Yeah, see, that's the thing. That's the thing. I need to have it. That's why with this light over here, I think that it makes for a better, I can get a better look at it. It needs to be white light, not the yellow light. Pair with heart rate. Yo, it's so hard to get his heart rate though. 140 to 200 beats per minute. That means it should be going like, okay, I want to hear 140 beats per minute. Okay, give me 2 audio for 2 audio. 1 for 140 cat heart rate and 1 for 200. It's actually going to give me that. I need to get the speaker. I couldn't find it. Did it give it to me? A synthesized cat heartbeat useful as reference. You give me the links. Hell. Give me something here. Thing? What are you telling me to search? There are 2 usable links you can open your browser. Here we go. Eight hours. So that's a slow one I'll have to count. Alright, that's kind of fast, but that's interesting. They made an 8-hour long 140 BPM cat heartbeat video to sleep to. Isn't that wild though? This is like a good heart rate for a cat to be chilling at. It does that constantly, its entire life, if not faster. Alright, now this is Listen to the faster end, it says. I don't know. It's not the same speed. Yo, give me better 200. Give me. Here's a match like a fast, steady cat style heartbeat that you can tap along with approximately times higher end rate. Mother pet. I don't know if this is it or not. It's not. Yo, that's the trick. I was got that. Interesting. I don't know about that one. It does say it's near the upper end of normal cat's heart rate. Okay, but how to map? Play the audio once and get used to the rhythm. Then put your fingers on Simon's femoral pulse inside the rear leg, just above the knee. Just above the knee. Count beats for 15 seconds and multiply by 4. If you feel Simon's pulse is as fast or faster than the pulses in that 200 BPM style audio, he's likely taking part in the upper range of normal beyond. His pulse feels anywhere near that speed, especially with pale gums. It's fine. Wait, did I say I might be mistaken about the pale gums now that I looked better? I know. I said no. You know, it's thinking. It's like, what does it make sense? Bro, I said some stupid shit. I should have worded that differently. No, I broke it. Here we go. It's thinking. That's interesting. I cut my grass and now the neighbor has their gardener over here doing theirs. I only used a weed whacker and a broom and a rake. You're not the only one who's mistaken. Cat tongue color is subtle and lighting makes a big difference. If you're no longer sure they're pale, it's actually a good sign. It means they're likely closer to pink or salmon, especially with both ears warm and a resting rate at 36 while awake. That's what I was thinking, man. Like, I was like, why is it freaking out on 36? Do this. Good late night, by a window, not under dim lamps, lighting. I turned all the lights on in there, but they're not white light, unfortunately, so get Simon in a calm spot, then gently lift his upper lip so you see the gums above the teeth, not just the tongue, side where gums look darker. Not just the tongue side where gums look darker. Normal pink looks like. Normal gums are salmon or bubblegum pink, slightly lighter than human's gums, but clearly pink and not white, gray, or yellow. Some cats have darker freckles or pigment, but the non-pigmented areas should still look pink. The capillary refill test. Press your fingertip on a gum for 1 to 2 seconds until it blanches white. Then remove pressure and count how long it takes to go pink. Normal color returns in 1 to 2 seconds. Abnormal takes longer than 2 seconds or stays pale. Alright, I gotta do that one next. Compare size and repeat. Check both the left and right side of the mouth. Consistency is reassuring. If today they look convincingly pink and refill quickly, then earlier pale may have been a lighting or angle issue. When to still call the vet. Even if you're not if you're now unsure about pale gums, keep watch for persistent pale to white on repeat checks. CRT over 2 seconds. That's the filling of the pink to white or white to pink. Resting respiration rate consistently over 35 or 40, or over 30 while sleeping. Yeah, see, that's the thing. Over 30 while sleeping, that's become like a normality. Lethargy, reluctance to move, or open mouth breathing. His mouth's barely open. He's been moving all morning. Now he's finally taking a break. Oh, look at that. He looks good. Like that's a good resting posture and everything. But we're not out of the woods here, folks, because he's still breathing pretty damn fast over there. It's hard to see though. Ow. See if we can get in there with it. One, two, 4, 5, 6. Oh. 35? I was maybe 35 right now, but he's still awake. So still around that 36 we hit a second ago. Data centers where higher, but we gotta get you higher. Where? Tidy? This is not tidy. I look like a hoarder. All right, let's get a little closer. That's more like 34, closer to 34 than 35. So, now 34, eyes closed. Update it, let it know what's going on, what's going on. Chantilly lays. While awake, but not fully asleep. That's a mild improvement from your earlier 36 to 44 range, and eyes closed suggests he feels safe and relaxed, not struggling. What this likely means, respiratory 34 awake is still a bit elevated, but withheld he has at rest, but not an emergency if his breathing is smooth and quiet. No open mouth, no belly heaving. His gums look pink and refill quickly. I don't know, I'm not bothering. I'm not poking his mouth right now, so if they look, I think they look pink maybe. His ears are warm, but closed eyes usually mean he's not in acute distress. He's comfortable enough to rest, which is reassuring in a CHF cat like Simon. What to do next? Monitor closely for 1 to 2 hours. Check when he truly sleeps, laying down, no eye movement, no sudden shifts. A good sleep restoration rate is typically in the 20s, low 30s for Simon. If he's sleeping, respiration rate is 25 to 32, that's a solid improvement. Repeat gum check in natural light. Lift upper lip, press then release to confirm they're pink, not pale. If his resting rate creeps back to the 40 plus while awake, or you see open mouth breathing, belly heaving, or truly pale gums, call this vet. He's gonna be this phone number of this vet, dude. I'm gonna end up calling this vet probably just because the bot keeps recommending them, and they were the cheapest on the list. Or your regular vet today and say, Simon's awake, respiration rate is 36, now 34, with eyes closed and warm ears, and sure if gums were pale earlier, give me a target sleep and respiration rate and tell me when to bring him in. Yeah, dude, I'm not even trying to bug these people. They seem like I'm bothering them when I call them. Right now, this sounds like trending in the right direction, especially after no gabapentin today and warm ears. I haven't been gabapentin in days. He hasn't gotten gabapentin since his vet visit last Friday. It helps clarify things, it says. Interesting. Now it's saying when to call the vet. A minute ago I had this thing saying it was urgent. Fatality is imminent if I don't get on the phone now. Pretty much, dude. Yo, I think the AI is gonna freak a lot of people out. They just take what it said, like everything it says, without like thinking, hey man, maybe it's like, maybe the bot has to think worst case scenario to protect people from ourselves, protect us from ourselves, from helping and hurting by helping. Ow! Wait, what? Dude, why aren't they giving me my lab results at least, man? I want to see what the hell is going on in his blood. And they said they wouldn't send that until I talked to the vet, and they're not calling. I think they're gonna call. They were like, I deal with that shit. Ain't nobody got time for your old ass cat, boy. That's what they do. Oh, sure would be nice to see his respiration rate go down. Dude, look at this thing I got for 97 cents. pull-apart cheese bread, stuffed cheddar jalapeno. They had a bunch of them, dude. I only got the one. It's a product of France, dude. I was like, dude, 97 cents. Yeah, I'll give it a shot. It's only $1 for this big old thing. 130 calories times 13 up in here. That's a lot of calories. I could eat this whole thing easily though. That's why I only got one of them. There's two of them though. Yeah, there's two of them. So, but that means each one of these has half that. The creamies look pretty good. Ow. 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 Oh, I'm having like sharp pains right here. I had sharp pains in there all of a sudden. That was weird. Best seat in the house. I'm back in the saddle again. Terpenes, baby. Terpenes, baby. I always wondered if the increase of pemobendin and sotalol could have made his respiration rate go up. Could his previous increase of pemobendin and starting sotalol in combination be the reason his respiration rate is higher. It's really digging hard on this one. Still thinking. Assessing whether pemobendin increase and sotalol initiation together explain his elevated respiration rate. Oh, there it goes. It took that long. Yes. Oh no, it said yes. Combination of increased pemobendin and starting sotalol could be contributing to Simon's higher respiration rate, but it's not the only explanation. It doesn't automatically mean something's wrong. The drugs affect heart rate and blood flow, which can shift how easily he breathes at rest. He was relatively stable on prior doses. After he gained increased pemobendin, better pump, but more fluid shuffling needs furosemide to keep up. Sotalol startup, slower heart rate, and possible subtle increase in low output congestion. If his furosemide is not keeping up with this new heart drug combination, you can see gradual creep in resting respiration from 20s to low 30s. up until the mid-30s, even if he still looks comfortable. What you should watch next. They didn't tell me that, dude, that the combination of those would make it so we needed more furosemide. Why didn't they tell me that? I'm just now learning that. Because we didn't increase it. We didn't increase this furosemide when we gave him those two things. Or when we increased his pumabin. Remember. We definitely did. They wanted to. They were out talking about giving it to him 3 times a day. The 5 3 times a day. But then they were like, well, no, he's doing all right with just the 2. So I was like, okay, cool. Well, we'll keep with that then. But, interesting. Respiration consistency 40 to 45 while awake. Over 30 to 3 while sleeping. Wonder if he's sleeping right now. Watch out for open mouth breathing, belly heaving, unwillingness to lie down. Panting. Open mouth with rapid breathing, not just a relaxed mouth. Truly pale or cool gums despite warm ears. If you're not seeing these signs, we're calling the vet and asking if they can recheck his heart. Oh, if you see these signs, check your his heart in rhythm, ideally with ECG, or just the furosemide dose, or timing to match the new pumabin glaucoma, which is why I'm increasing it. I'm already on increasing the furosemide to see roll it out first. Stage around 30 to 45 hours for warm ears, peak gums. Pattern suggests a higher respiration adjustment phase, not an emergency. The vet still needs to know this change, but it's appropriate to monitor and then discuss at your next scheduled visit opponent. Current respiration rate. Actually, I need to know if he's asleep now. Let's see. It wants to know more. No, he's not. His eyes are open. That's 38 there. We try again. I gotta start over. Damn it, he went up. He changed positions. He's still awake though. Yeah, it's around 18 or 19. 18 or 19 respirations per minute comes out to 36. So that'd be 37 roughly, 37 respirations. It's high. He's still awake. Yeah, still awake. Still awake with eyes closed. Straight 37. comfortable and comfortable. It's going to be a slight increase from last observed. Beep, beep, boop, beep, boop, beep, boop, beep, boop, 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 beep. Damn, man, they're like throttling me or something, dude. It's taking forever to do these now. They didn't know how much I would take advantage of their free, but now they're trying to get me to pay like this monthly fee, dude. I get it now. Like, this is their way to try to get me on that other shit. They're just making it throttle down. But it's like $100 and something a month, dude. I'm thinking about it though. Upgrade plan, how much does it cost? $167, dude. That's for only 1 month. The other plan, the regular plan, is only $17 per month. Apparently that's the one I got. Making me feel like what I got's not enough now. It's still thinking. That's how they get you, boy. That's how they get you. That's how they get you. Come on, man. Fancy feast. Would you want to impress the ladies? So baby, you hungry tonight? I got something extra fancy. Yeah, baby. With 2 motherfucking peppers. Bon appetit, baby. Motherfucker. Bon appetit, motherfucker. I kind of like not having 4 different kinds of cat food down there, but I still currently have 3 because Simon stopped. I wonder if he'll eat this one again. This adult 11 plus one. He's up here. I don't really need the box. Taking up space down there anymore. I'm saying, gang, gang. Make a little room over here, huh? Capiche? Capiche? It's still thinking, dude. I'm gonna refresh this shit. An awake resting rate of 37 with eyes closed, closed mouth, and clearly comfortable is mildly elevated, but not alarming for a cat with heart disease, especially after recent female bend dose increase in starting sotalol. Well, he started those. He timing is important. 2 minutes increase in sotalol started 2 months ago. The silence current was very awake with eyes closed. It's not a sudden change from those meds. It's more likely his new baseline of the regimen, especially if he has been stable since then. Many cats with CHF land in the mid-30s awake resting rate on modern meds as long as he's still comfortable napping, no open mouth breathing, eyes closed, no restlessness, gums look pink and refill quickly, and ears are warm. This can be managed, not an emergency, resting rate level. Because the change happened 2 months ago, not last week, you're probably seeing an equilibrium from phenylbutyrylsulfonol plus furosemide rather than an acute worsening. Now, how to use this info. Monitor his sleeping respiration rate tonight. If he stays 25 to 32 while deeply asleep and he continues to eat and rest, this is consistent with stable but higher baseline respiration rate on his current meds. When you next speak to the vet or your next check-in, describe it as if at any point his awake resting rate or respiration rate climbs into the 40s, what? Come on, bro. Or sleeping respiration rate exceeds low 30s, or he loses ability to nap comfortably, that's when you consider medication recheck rather than waiting for the next routine visit. So he's going to be in the 40s again, dude. He's probably in the 40s right now. He is. He's like 46 right now. Eyes clock 13 in 15 seconds. Pretty much the same thing, 12 or 13 right there. One, two, three, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 20. About 20, 30, so that's 46. That's what I said a second ago. Current 46. Awake, name. Eyes open. Mouth closed. And comfortable. It's all over the place, man. A resting respiration rate of 46 while awake, laying down, eyes open, mouth closed, and comfortable is above the safe range for a cat with congestive heart failure. And even he looks relaxed right now. What it means: heart disease, 25 to 30 while awake, usually acceptable. 35 to 40 is borderline. 40 plus while awake is considered abnormal and concerning, even if the cat seems calm. A resting rate of 46 often reflects increased work or breathing from lung congestion, early pulmonary edema, or low output heart failure, even when a cat doesn't look obviously distressed. What to watch out and go back home. Even though Simon is laying down, has eyes open, mouth closed, feels comfortable to you. Respiration rate is needs professional review today. Respiration rate consistently above 45 while awake. He has no CHF. He's on phenylbutyrylsulfonol for like this. It should be without big changes. Good. Even if at any point he opens his mouth to breathe, starts breathing with visible belly effort, becomes restless, or unable to lie down comfortably, treat as urgent. Bro, that's some bullshit. I don't know what to think. Arrest and restoration at 4608 is not a crisis if there are no other red flags, but it is a change from its previous baseline. It should be evaluated by a vet within the next 24 to 40 hours sooner if he worsens or if you see pale bumps, cool extremities, or open mouth breathing. Why is a Top Gun song coming up? What the fuck is wrong with me, man? Folgers, America. I mean, of course, the only real American, or I should say, United States coffee. The only real United States coffee is actually Kona coffee. Out in Hawaii. I mean, all of the coffee is imported into America and they process it, but Kona's the only one that's actually grown here. I've tasted it right off the bush. It doesn't taste like coffee when you get it like that. Even when they're ripe, it doesn't taste like coffee. Chewing them right off the bush. They were out near North Shore, I remember. They weren't even advertised because the Dole plantation was out there too, and it's heavily advertised as being like a tourist trap. There's this big ass maze that you walk through, and I think they had the Dole Whip there, like this beverage, and then there's I had macadamia nuts there and shit. The chocolate covered macadamia, I can't remember what all they had there. But there's Dole, going out to North Shore in Oahu, there's in some places fields as far as the eye can see, pineapples. It's the tops of them. I guess they grow out of the top, huh? So it would be the bottoms of them. Like you pluck them off the top, right? Why my belt isn't tight enough? Yeah, I keep pulling things up. Alright, there, we fixed that. Finally, I fixed it. It's almost time to use Simon his other medications. Organic Kirkland coffee. Kirkland milk. I don't think I've ever gotten Kirkland milk before. Yeah. Let me look back on the vet notes actually. Says Simon was seen today because he is losing weight, not eating well, and has ongoing chronic vomiting and or possible regurgitation. In cats, chronic vomiting can be caused by stomach or intestinal disease, while regurgitation is more passive and it's often related to esophagus. Distinction can be difficult at home, and sometimes cats have a combination of problems contributing to these signs. Simon also has known hypothyroidism and heart condition that is suspected to be hypertrophic cardiomyopathy and left ventricular outflow tract obstruction. HCM is a common feline heart disease where the heart muscle becomes abnormally thick. When the muscle thickens, the heart chamber has less room to fill and blood flow, leaving the heart can become turbulent or particularly obstructed. This can increase the risk of congestion heart failure, fluid buildup, and can contribute to poor appetite, weight loss, and changes in breathing. Today's time his blood work is generally acceptable. However, his thyroid level is higher than our goal, meaning hypothyroidism is not as well controlled as it should be. Uncontrolled hypothyroidism can contribute to weight loss, increased metabolism, nausea, and worsen heart strain over time. Simon's radiograph showed an enlarged heart, cardiomegaly. There is also concern for possible pulmonary effusion or fluid associated with heart disease. When cats develop heart-related fluid accumulation, it can affect breathing and energy levels. Because of this, careful monitoring at home is very important. Treatment performed today: physical exam, blood work recheck, overall acceptable thyroid elevated above goal, thoracic radiographs, enlarged heart, concern for possible pulmonary fluid. I don't understand why it says possible pulmonary fluid. Can't he fucking see? You know what I mean? Can't he see whether or not that's there? And that's the whole point of the fucking chest X-ray. That's what kind of alarmed me in the clinic when he was like, "There's possibly water there." Like, hold on. Do you know what you're looking at, doctor? She's supposed to have some good equipment in there. What else we saying here? Adjust medications to support appetite, control fluid, and better regulate thyroid levels. Meritaz, apply once daily while we are using it. Meritaz is an appetite. It helps increase appetite and can reduce nausea in some cats, which may improve food intake and help with weight stabilization. Common side effects: increased vocalization, restlessness, clingy behavior, mild agitation, rapid heart rate, drooling, vomiting, or diarrhea. If someone becomes very agitated, pants, seems disoriented, or has significant vomiting or diarrhea, sought medication. Contact us. Furosemide, increase to 10 milligrams by mouth twice daily. See, we discussed that. It was supposed to be 5 milligrams 3 times daily, so I don't know what happened. Something happened there. We talked about both, and he was like, start with the 5 3 times. I said, okay. They switched it. Furosemide is a diuretic or pill that helps remove excess fluid from the body. In cats with suspected congestive heart failure or fluid accumulation, it helps reduce fluid in and around the lungs and supports easier breathing. Common side effects: increased thirst, urination, dehydration, and water if water intake is inadequate, and possible electrolyte or kidney value changes. Methimazole increased 3.75 milligrams by mouth twice daily. Methimazole lowers thyroid hormone production and is used to control hypothyroidism, better control, can improve weight, appetite, and reduce strain on the heart over time. Common side effects: decreased appetite, vomiting, lethargy, facial itching, and rarely effects on liver values or blood cell counts. Liver values? Is that why his liver value is a little fucked up? Or probably from the lack of food. Contact us if you notice severe lethargy, persistent vomiting, facial scratching, yellowish eyes or gums, or any sudden decline. Home care, appetite and weight. Offer a highly palatable diet, monitor daily food intake, track weight if possible. Weight loss in cats can become serious quickly. Monitor breathing, very important. Please continue monitoring Simon's resting breathing rate at home. This is one of the best early signs of fluid buildup and related to heart disease. Count breaths while he's asleep or deeply resting. One rise and fall. Just one breath. If resting breathing rate is consistently increasing, or if it persistently elevated compared to his normal baseline, please contact us promptly. If Simon's open mouth breathing with obvious effort, and appears distressed, this is an emergency. This sounds like a fucking AI wrote this, bro. That's why I didn't really like go through it with a fine-tooth comb. The way it's like bullet pointed and shit. Anyway, vomiting, regurgitation monitoring, note frequency and timing relative to meals. And he hasn't actually been doing that over the past few days. He has not been waking me up with puking up clear shit. I haven't seen any anywhere for a few days now, so that's interesting, man. Maybe he just doesn't have the extra saliva draining into his stomach now. Who's that Cottonmouth? Because I used to always think he was doing that because he was drooling a bunch and it was just collecting in his stomach. Follow up. Please call us if Simon's not doing well, is not eating, continues to lose weight, is vomiting frequently, or his breathing rate increases. We recommend follow-up blood work to reassess thyroid levels and monitor kidneys, electrolyte values after the medication adjustments, especially with the increased furosemide dose. He just got up and he's walking down the hallway. I think he's gonna go take a poop or something. Let's go see. Oh, this might be. Maybe he'll give us a poopy too, y'all. Cross your fingers. Cross your fingers, everybody, for a nice poopy. Maybe we get to see it. Oh yeah, wouldn't that be sweet? Come on, let's get us a poopy, Simon. Come on. What are you doing? Come on, get in there. Get in there and give us a poopy. Come on, you know what I want. I haven't smelled it all day. Come on, give me a poopy. Come on, hey, you're making a mess. Come on, give me a poopy. Give me that poopy, Simon. Yeah, get in You tricked me. Get in there, get that poopy. Yeah, get in there. Get in there and get that poopy. Wait, son! You're making a fucking mess, Simon. Simon, go, get in there. Simon. Get in there and give me that poopy. Get in there and give me that poopy, buddy. That's right. Get in there and give me that poopy. I'm the cat shit whisperer. Come on, buddy. Give me that poopy, baby. Baby boy. Yeah, let's see it. Let's see it. Be sure to face me, okay? That's a good boy. Yeah, let's give me that poopy. Oh, shit. Oh, shit. Oh, shit. Ooh. 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 Juicy. Oh, no, it's touching the foot. No. Oh, God. Fuck. The foot's gone. The foot's gone. Okay. Oh. That's Simon. That's good. Here, I got the rest. Here. Right, you're good. Come on. Let's go. No, you're good. Let's go. God, that stinks. Oh, man. This is going to sell for top dollar. Did you see those bad boys? Do you see how fresh they are? Oh, I got to get them now. I got to get them on the market while they're still with so much freshness. And that chunk, that pea clump right there, that's nothing but the best, Simon. You really created something with this one. Ooh-wee. I can almost see the stain coming off of it. The poop's got a decent firmness to it, nice brownness. Oh, good boy. It smells like gunpowder. Chinese are going to do some amazing stuff with this. Oh, yes, sir. Yes, sir. Yes, sir. Good kitty. I tell you guys, I don't think I would be able to live in California if it weren't for the added revenue that the cat shit gives me. Are you guys the same way? I mean, I know Miss Bumble is. I don't know if Sister T is. How is it? Oh, it's time to get his medicine. Less stomach acid. What? What are we talking about? Alright. Dude, that towel has something going on. There's something going on, bro. I can't be using that anymore. I go through some towels, dude. I'm constantly washing my hands over and over and over. But that towel, there's some fucking shit going on right now. I'm super sensitive to scents. I actually stopped dating this chick because her parents' car smelled weird. She was using it to drive us around. Long time ago, boy. That's a fucking long time ago, boy. Hey. Hey, good looking. What you gonna cook me for? Okay, chemo benzene. Check. Sotalol. Check. They know what is what, but they don't know what is what. They just stress. What the fuck? What the fuck? Just a little dash. Just a little dash. Okay. Got this. We got that. Now we just need one more thing. Here's these two little tiny pills that apparently taste like shit to him. Pemobendin and Sotalol. .875 Pemobendin, 5 milligrams Sotalol. Time for this stuffy tough. Come on. Yeah, I can see what you're doing. I see what you're doing. You're trying to. Boom. There's one. Good job, buddy. You did it. You're almost done. Alright. One more. Come on, chompy chomps. Oh, this is a bad one. We got a bad one. We got it down there. We got it down. Good job. Here, have some water. Should we? Alright. No. That was a bad blunder. And one more. Good boy. Trippity trip. Trippity trip. Trippity trip. Hey, how you doing? Alright. I didn't even see another cat out here today. you drink it then? I'm also starting to wonder if me giving him that hydrocare is interrupting or getting in the way of him absorbing the pimobendin or sotalol. So I'm tempted to give him more hydrocare, but at the same time, I don't know if that's interfering. If I put fresh in there, he'd probably drink it a bit too. There's a lot left. So you want some food? He's right here. He's been acting kind of itchy lately. He hunches down and licks his belly like that. Scratches. I am supposed to watch for facial itching, but is that facial itching? What's up, man? Yeah, Britney Spears, dude, even her subreddit is talking shit about her, like they shouldn't have given her the rights to all her shit. He was on the desk looking all like guilty. Simon's following me around now. Ears are cold. This ear's cold. I need to look something up. Come on.
Ears getting colder roughly 23 minutes after Primobitin and Sotalol is concerning because it suggests reduced peripheral perfusion. Less blood is reaching the skin of his ears, which can be a sign of low blood pressure, low output heart failure, or the combined effect of drugs on the circulation. Primobitin dilates blood vessels and increases heart contractility, which can sometimes drop blood pressure in sensitive patients, especially if furosemide has already removed some fluid. Sotalol slows the heart rate and can reduce how hard the heart beats, which in some cases leads to lower cardiac output, less blood pushed forward with each beat. Cool ears occur when the body shuts blood away from the skin to maintain core circulation, which is a compensatory sign in heart failure or low blood pressure states. What this suggests, resting right at 36 awake, already indication as long as they're working harder. Cool ears 20 minutes after suggests the combination may be dropping his perfusion or shifting the circulation in a way that's not ideal. What to do now? Check the gum color and refill. Are gums still pink? How many seconds does it take for the color to return after pressing on them? Sorry. Where the fuck did he go? He's weighing in at 9.3 right now too.
Damn it. 9.3 now. Yeah, man. Dude, this is an everyday battle here, keeping Simon alive this morning. I don't know how to do this, Simon. I don't know how I'm supposed to be fucking with your gum like this. I really don't. I don't know how I'm supposed to do that. You don't want your mouth open. So, how am I supposed to fucking do this? Yeah, I don't know. He doesn't want his mouth touched and shit, dude. How the fuck are you supposed to do that one? Good luck with that shit, everybody. I can't do it. I'm incapable. I'm not good enough. Apparently, you gotta be fucking bad to do that one. I've never even seen him pressing on his gums like that. Watching them. breathing, man. Let's check that again. Ah, 35. Fuck. So, sitting up. Is there 25? Is much better. This says the respiration rate 35 also is much better than the 46 you saw earlier, especially if he's still comfortable, mouth closed, and not using his belly to breathe. If he's using his belly or not. Does he use his belly to breathe? Using your belly to breathe? Why are you acting itchy and shit? Is the flea still? So I need to read the rest of this. I wish you would just stay still. Huh? Did you do that? Okay, you're not doing that. Alright, he's not doing that. He wants food now, apparently, which is a good sign, but I wish he had eaten earlier. Right? He's acting itchy again. He's scratching his head. Scratching the top of his head. Maybe he is acting like his head is itchy. Sitting up can improve lung expansion compared with lying flat, so it's common for cats to stage. You have to breathe a bit easier in that position. To drop from 46 to 35 after massive change of position implies no acute respiratory crisis at this moment, possible fluid redistribution, or better lung expansion with upright posture. However, because this is still above the ideal awake range for a healthy cat, which is 25 to 30, it's consistent with mild to moderate congestion on his current heart medication combo. What to do next? Monitor in this position for 15 to 30 minutes. If respiration rate stays around 30 to 35, that's manageable as long as he's comfortable. If it increases back to 40 plus, jot that down and mention it to the vet. Watch for signs of worsening any time of the day or night. A rate over 40, over 30 or 35 while asleep, open mouth breathing, belly, breathing restlessness. If you're able, check the gums and ear temperature again when he's setting. Pink gums and warm ears would support stable but congested. Pale gums or cool ears would mean call the vet today and say his respiration rate has dropped. Of course, if we're... Right now, this looks like improvement from 46, but it still confirms that his current respiration rate is higher than ideal. Something to discuss with the vet. Dun-dun-dun. Dun-dun-dun-dun. Ow. Dun-dun-dun. Oh, he's sitting there again. I can take it again. Are you ready, Simon? No, wait. God damn it. fucking damn it, dude. What, man? Can you sit there, please? 1, 2. I can't, dude. He's fucking sniffing the air or something now at this point. What are you fucking smelling, dude? What's going on? What are you doing? What are you doing with your face? You're twitching and shit. So are you having a fucking seizure? Are you having a motherfucking seizure? What? Hey man, seizures aren't funny. So this says I'm supposed to monitor him right now, but I can't get his fucking pulse because he keeps meowing and shit. I can't get his respiration because you keep fucking meowing. Shut the fuck up! Shut the fuck up, cat. Stop sniffing. Stop meowing. Sit there, okay? No, not here. There. 9.4. Hey, you gained a point. Now I can't see, dude. Okay, so that was 16. Or no. Yeah. So plus 1, 16, so that'd be 32, 33, roughly 33. It actually went down a little bit. I got around 33 there. Anybody else count it? To 33, 32 to 33, sitting up, same, circumstance. A resting respiration rate of 32 degrees while sitting up, same circumstances, much closer to an acceptable range for a cat to congested heart failure, especially after you saw 46 earlier. This range means 25 to 35 weeks considered manageable. 32 to 33 sits in the upper end of the acceptable range, but it's not an emergency as long as breathing is quiet and smooth. No open mouth breathing or belly. I don't think there's belly effort. I don't know. He remains comfortable, able to rest or nap. I'm not sure about that either. Ask hungry right now though. His gums are pink. Yeah, I can't check the refill test. Sorry about that. They look pink, I think. I'm not sure. His lungs are moving air more easily when upright. Fluid redistribution. Posture benefit possibly. This is consistent with mild to moderate congestion on his current pimavanserin sotalol and furosemide regimen rather than crisis. Okay. I need to check him when he's sleeping. Note that he's in the upper 20s.
That is to say, if I ever see it over 40, treat this as urgent. He's always over 40. Like it's interesting he's not right now. His left ear is colder again. Left ear colder than right ear. Is this the same as, I think it is. Left ear knows to be colder than the right ear is not exactly the same as both ears cold. It can be a sign of altered perfusion. It should be monitored, especially in a cat with heart failure who is recently changing it. The body sometimes shuts blood away from one side slightly more than another, so mild asymmetry can be normal in some cats. But when you're clearly colder, it can also reflect mild low output heart failure, local blood flow imbalance, recent medication effect, changing blood pressure, perfusion, a bit of body position when you're pressed against something, or pure drying pattern. Where does room air current vent? Hitting one ear more. If both ears were warm earlier and now only the left ear is cool, that's a change and worth watching, even if the right ear is still warm. If only the left ear is cool and the gums are still pink with fast refill, he's moving comfortably. Resting respiration. Or respiration rate 30 to 32, 32, 33. That's concerning amount of mercy. It's still concerning though, shit. Is it because he's getting too much of one of those medications? Well, it could be, it says. Yes, ears getting noticeably cooler after feeling good in social. It could be because one of the combination is reducing his blood pressure, cardiac output enough that less blood reaches the skin of his ears, even if he's not collapsing. That doesn't mean the dose is wrong for everyone, but it can be too much for him at this moment. I see. So maybe it like levels out. It's just throw him in the first hour. Okay, the combination can sometimes overshoot his ideal sweet spot, leading to mild low output perfusion despite good lung fluid control. He gets his meds, and 23 minutes later his ears feel cooler, especially one side. At the same time, his resting rate has been elevated. What? Up to 46, then 32 and 33. This suggests his circulation is not crashing, but it's not fully robust yet. The timing is suspicious for drug-related perfusion change. If the cool ear pattern happens repeatedly after each dose, not just once, that's strong evidence it's related to the meds. Yeah, I'm gonna really pay attention to that tonight. That means I'm gonna have to stay up after giving him his heart meds. Yes, cool ear right after those two meds can be a sign he's getting too much effect from one or both, especially if it happens consistently and is paired with the other subtle signs. It doesn't always mean emergency, but it does mean that the vet should know about it. And consider tweaking, yeah, baby, the regimen. Oh, sorry. Yeah. I thought he was talking to someone else. He's in there chilling. I don't recommend doing that, by the way. I'm not one to do that. Tweaking. Just a little bit of tweaking. Hey, Golden. Just a little bit of tweaking. Here, let's have one of these. Oh, wait. Should we have one of the other ones? No, we'll have one of these. Gotta get in the zone. Get rid of this scurvy. Starting to feel the scurvy coming on. There's some new virus traveling through California. Y'all heard about it? Apparently there's no vaccine for it. It's up in Northern California now, and they said it's going to come down to LA soon. Summer virus or what? What is that? Spring virus? Where'd that come from? Dude, that's too big. Yeah. Oh, it's coming. The whole world will know about it soon. Remember, COVID started off kind of small. Like in the beginning of COVID, nobody was really worried about it. It was only at the very, very beginning though. But it didn't take long before everybody was scared to talk to each other within like a 3-foot distance.
You know, candy is like fruit for poor people. They took the candy benefits away from the SNAP people. What a shame. That's their vitamins. Shame. You know what's really interesting about it? I thought about this before. That, like, in the beginning, the candies were for rich people. I mean, affluent, like rich aristocrats or shit are known for giving, like, jelly to each other back in the day because, like, it had sugar in it. And stuff with sugar was hard to come by. And nowadays, it's like the fucking poor people eat the sugar instead of the fruit, and fruit is more of a luxury item for some fucking reason. Like sugar production just ramped up crazily, and it's cheaper to produce now than fruits are. Apparently. But it switched up. Sugar used to be for rich people, and the fruits would have been what the poor people would have had an abundance of. They would have had like fruits and vegetables. But that shit got switched up. Now the rich people are eating the fruits and vegetables, and the poor people are eating all the processed shit. I'm gassy. That's because it's all natural, though. It's an all-natural burp. No artificial flavors. Oh, I forgot I got something. I haven't even looked at it yet. 2,000 milligrams can of butter. I forgot I had this. Full spectrum. Big Pete, Santa Cruz, California. Indica. $65 for 2,000 milligrams. Crime. Got that crime. Where's the fucking sell-by date on here? Best by 10/29/26. Package 10/29/25. Huh. Let's look at it. I don't even know how to open it, honestly. There it is. Ooh, it's green. Look at that. Look at that shit. It's green, folks. Dude, it doesn't even have like a child protection lock on it. That's interesting. I could just like you could have this in your fridge and your kids could mistake this for some butter. Holy shit. It only takes 1 tablespoon is 250 milligrams. oh, 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 oh. Yeah. Okay, it's time to get Simon's bowl ready. Simon, you hungry? You want some food, boy? You want some, Simon, you want some food, boy? Simon, how you want some food? I want some food, boy. I know. Hey, Simon, you want some food, boy? You want some food, boy? You want some food, boy? Oopsie. Yeah, Simon. Yeah. You want some food, boy? One potato in here, boy. With 2 motherfucking peppers. $94. Yeah. want some food, boy? You want some food, boy? You want some food? You want He don't want some food, boy. He don't want some food, boy. He don't want it. He don't want some food. He don't want it. He don't want it. He don't want some food, boy. He don't want some food, boy. He don't want it. He don't want it. Yo, some food, boy. Yo, some food. Yo, some food. Yo, some food. Yeah, good boy. Yeah. 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 Food boy.
Dude, I haven't sat down at all today. Okay, I sat down for maybe a second to get my medication earlier. He wants in the other room. Alright, we can go in there, Simon. I guess it's time to sit down. Oh shit, did I take this? Yeah, Yeah, Christmas time. Christmas time, y'all. Are you guys in the Christmas spirit yet? That time of year. Where you going, Simon? Simon, aren't you in the Christmas spirit? Come on, let's go, Simon. Let's go. Come on, Simon. Come on, bro. We're coming this way. Come on. You wanted to come and now you don't want to come. Come on, come on. Come on. I am a mover, a shaker, a midnight Quaker. Quaker oats, bro. You know what I'm saying? Fucking Quakers. Awesome. What would we do without them? We wouldn't have the Quaker oats, bro. We wouldn't have those oats. The fucking oats, bro. Yo, we owe that to the damn Quakers, don't we? Having the oats. Do you like oats or not? I know I do. Man, I love some oats. Oats, bro. Oats. 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 What's he doing? Come on, man. Come on, Simon. 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 Come on, do something, bro. Oh, hi, sorry, to give you your attention. Hey, sweet pea. She's like, I don't want attention. I hate attention. Do ya? Do ya? You think you're so sweet, don't you?
are so sweet. Look how little she is. You're still so little. No, don't eat that. What is that shit? What is this? Why? What is that? I don't know what that is. Meow. Any minute now, Simon's gonna walk back in. I've cut my grass, dude. That's phenomenal. Look at that. I can look out there and it doesn't look like a jungle. She's tiny. Like her body parts are smaller. Her head, her eyes, ears, little toes. Each of the beautiful nose. Still some help. Great some other. Anyways, got pretty eyes. Oh shit, it was one. Hey. 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 What are you doing? You came to say hi to me. Pagey Mr. Herman. There. Mr. Herman. Did anything happen today? I can't really give Simon the top-notch health care I would like to because I do have these other cats. The gate and everything. He's doing all right in there. Christy, no one was demoted.
How do you square that concern for waste, which I share, with the fact that you have spent $220 million running television advertisements that feature you prominently?
Sir, the president tasked me with getting the message out to the country and to other countries where we were seeing the invasion come from, with putting commercials out that told them that if they were in this country illegally, that they needed to leave, or we would detain them and remove them, and they'd not get the chance to come back to America the right way. That has been extremely effective.
Ask you to run these advertisements, is that right?
We had that conversation, yes, before I was put in this position and sworn in and confirmed, and since then as well.
Okay. Did you bid out those service contracts?
Yes, they did. They went out to a competitive bid, and career officials at the department chose who would do those advertising commercials.
And the people that you ended up picking were people who had formerly done your political work back in South Dakota, is that right?
No, that's not correct, sir.
I think it is.
No, it's not, sir. The individuals who, I believe the careers who they chose were two different media firms. there's been conversation about their subcontractors, but we have no legal authority to look into subcontractors on work like that.
Okay. And you're saying that you're testifying that President Trump approved this ahead of time. Is that my understanding?
We had conversations about making sure that we were telling people.
No, ma'am. I'm asking you, sorry to interrupt, but the president approved ahead of time you spending $220 million running TV ads across the country in which you are featured prominently.
Yes, sir. We went through the legal processes, did it correctly, worked with OMB. Yes.
Dude, she got demoted over this? For real? This is wild, dude. She didn't actually ask him.
He did.
Yes.
Okay.
Maybe she...
One thing, Senator, I think would be helpful to know is how effective that communications has been.
We protested. Oh yeah, I saw that shit. That's crazy.
That
they were
overwhelmingly.
effective in your name recognition. I mean, I personally just, I mean, to me, it puts the president in a terribly awkward spot, and and I'm not saying you're not telling the truth. It's just hard for me to believe. I mean, the president, as I do, you said, Mr. President, here's some ads I've cut, and I'm going to spend $220 million running them, that he would have agreed to that. I don't think Russ Vogt at OMB would have agreed to that. It's something we have to defend. I'm on the Appropriations Committee. My research shows that you did not bid them out, that you picked, in fact, one of the people you picked, the strategy group, Safe America Media was a company formed 11 days before you picked them.
What?
And the strategy group got most of the money, and the head of that is married to your former spokesperson.
What?
We all have friends that are qualified. I'm not quibbling with that.
That's interesting. It didn't go to...
Troubles me.
Dude, they didn't allow for businesses to bid on this project, it sounds like. And she gave like $250 million to friends, pretty much, is what it seems, dude. She probably got a kickback on it.
A fifth to a quarter of $1 billion in taxpayer money when we're scratching forever.
Yo, I appreciate Senator Kennedy for, like, even though he's a Republican, he's still willing to give her shit. He's a trip, man.
Penny, and we're fighting over rescission packages. I just can't agree with Madam Secretary. Are you still running those ads?
No, Senator, I did not have anything to do with picking those contractors. No politicals at the Department of Homeland Security did.
I understand. Are you
Mayor
still running
officials
those
followed
ads?
the competitive bid process for
Are you
that.
still running
Everything
those
was.
ads?
I think the ads are due to end here in March. I think within a week or
So
two.
they
I'm
are
not
still
sure.
running?
The one that is running is focusing on angel families. Have you seen that? It is the one that's talking about this is our why. This is why we work every day.
Okay.
It's for the angel
I've gotta
families
move
and their
on.
victims.
Interesting. Pete XX's gonna talk. He meets with Central Command Defense. He's meeting with them right now. He is fucking meeting with them right now. What's happening? How about that submarine hit? Yeah, that was pretty wild yesterday. They hit him with a Mark 48, dude. Those things are like millions of dollars each. Look, like 75 million or something. Mark 48 cost. They're massive, dude. Oh no, 5 million. Okay, still, that's fucking crazy. It's a $5 million underwater explosive. They're so badass, we sell them to other countries. Like Aussies buy 125 million worth of Mark 48 torpedoes to help counter future threats. Heck yeah, boy. Torpedo. We need to use these things, man. We got like an aging supply. We need to use them up so they don't just go bad. Some countries have wheat, we have torpedoes. They use it up before it goes bad. We even had these things on board ship. It's not just submarines that have Mark 48s. We had a torpedo man in our division. They're not known for being a high ASVAB scores though. Torpedo man. I don't know what that means, but I always remember that. Low ASVAB will get you into the torpedo man position. Did his job. Did it do its job? Trump fires DHS Secretary Kristi Noem. Yo, I don't know if she was fired. Amazon employees steal $73,000 in Apple and Samsung products. Damn, April 4th, 2023. That shit's old, dog. The split seam on the boat. Oh, it did? That's what they said? Simon, what's going on? The Navy has been helping ICE. Military's gonna take over what? Oh, really? Weird. That's what he said? Epic fury. Evidence emerges showing staged Palestinian starvation. That's a CBN News, though. It's Christian News Network. I think that they are, though. Like, I think that they are staging them to look hungrier than they actually are. I've thought that for years. Because we would watch the fucking hospital cam, dude. There's just people walking around normally like nothing's going on, walking in and out of the hospital with snacks and shit. It's like... People showing up having a heart attack with a sandwich in their hand. we're talking about Gaza, Palestine, they're even more likely to fake shit. Well, I don't know, probably about the same, because they limit the amount of journalism that occurs and is able to get out. Justin Timberlake and Britney Spears got arrested recently. That's interesting. Driver fleeing from U.S. border checkpoint killed in shootout. The fuck? Was it an American? And Rhinestone Cowboy. Does it say on the 33-year-old James Douglas McMillan? K-Line had alerted officers on it of his car. Texas. But he began shooting at law enforcement. I wonder what the fuck he had, dude. It doesn't say anything else about drugs. Fucking look, there's got 41,000 people watching. Dude, multiple news stations are saying that Kennedy asking her about that money is why she got fired. Why did he get fired? Instead, you can't fire Kennedy. He's part of the institution. No longer Secretary of Homeland Security. Instead, will become the special envoy. Mark Wayne Mullen will become the United States Secretary of Homeland Security effective March 31st, 2026. The current Secretary, Kristi Noem, who has served us well, has had numerous and spectacular results, will be moving to be Special Envoy for the Shield of the Americas, our new security initiative in the Western Hemisphere. What? The fuck? He just makes positions to put people in. We are announcing on Saturday. Fucking weird. Oh my god, this news goes all in on Britney.
To follow the breaking news surrounding pop star Britney Spears. She is in trouble with the law again after being arrested on suspicion of DUI.
Good morning. Yeah, we are here in Westlake Village, which is right near the border of LA County and Ventura County.
I can't get the fucking volume on there.
Know that this is also not far from Britney Spears' home and also where she was taken into custody last night. Want to take you to the video now and tell
she
you
was at
that
home?
Jail records from the Ventura County Sheriff's Office confirmed she was pulled over and taken into custody by the California Highway Patrol at 9:28 p.m. for suspicion of DUI and booked at 3:02 a.m. this morning. She was released on a cite and basis just after 6 a.m. today. The arrest reportedly taking place near Britney's home in the Thousand Oaks area. Some reports say she was pulled over in the Moore Park area. Others say she was arrested here in Westlake Village. We are working to confirm those details right now.
She used to be
According
popular,
to TMZ,
dude.
officers transported
crazy.
Spears directly to a hospital, a standard procedure used to conduct a blood draw to determine her blood alcohol content. TMZ reporting sources close to Mrs. Spears say her BAC levels came back at 0.06. That's below California's legal limit of 0.08. But it's important to note you can still be charged with DUI in California if officers observe erratic driving, regardless of that blood alcohol level. Police have not officially released those test results, but TMZ also saying Spears was clearly emotional while in custody. Britney's manager, Kate Hudson, telling TMZ in a statement, quote, "This was an unfortunate incident that is completely
That's a trip though, where blood alcohol was low. I didn't hear about that part.
And hopefully this can be the first step in long overdue change that needs to occur in Britney's life. Hopefully she can get the help and support.
Dude, she's like 100 millionaire now or something, ain't she? She's selling her album or music, all her music.
Plan to set her up for success in her mental health and well-being. This marks Spears' first DUI arrest. Her prior legal troubles date back to 2007 when she faced misdemeanor charges for an alleged hit and run with a parked car in LA. Those charges were ultimately dropped. The 44-year-old was freed from a controversial 13-year conservatorship in 2021.
She still looks pretty young, though.
Month, she reportedly finalized the sale of her entire music catalog, with industry experts reporting that deal was worth approximately $200 million.
That's crazy,
Back
bro.
out here live, we can tell you Spears' Instagram account has been deactivated since this arrest. Her next
How is it
court date
worth so
is
much?
set in Ventura County for May 4th.
Like movie rights and shit. Like I really don't get it. If she's no longer making music, how is her music just gonna stay relevant? Unless it's in like upcoming movies and whatever. I mean, like oldies music. How is oldies music really making a lot of money nowadays for like the 70s artists, unless they get put in a movie?
Press conference. Now that's over, I was wondering, like, what
I was
if
wondering
at the same time.
I can't with that guy, dude. That's a fucking goober. Sounds like a Muppet when he talks, dude. He sounds like a fucking Muppet from the Muppet Show. I'm pretty sure he wants to sound like that. Dangle. Angle of the dangle. Angle of the dangle. Well, that's something. Dangle of the dangle. Dangle of the motherfucking dangle. And 2 motherfucking peppers. Alright. Painter.
Mercedes. catsThis.
As we need to. Again, our munition status only increases
Hey, you just
as our
started talking.
operation. Well, good afternoon. I'm honored to stand right here today alongside one of America's finest, Admiral Brad Cooper, Commander of U.S. Central Command. We just had a chance to spend a couple of hours together, better part of 2 hours, going through the entirety of this operation, Operation Epic Fury. And Admiral, I want to thank you for everything you do in your incredible leadership, your dynamic thinking, the way you're attacking this problem set on every level. In just days of Operation Epic Fury, you and your team have delivered.
What the hell does the better part of 2 hours mean?
Sort of devastating, precise strikes, taking out the better part of Iran's navy, making it combating.
The better part of the navy? Is that good or bad? Is that worse than the not so better part?
Neutralizing missile sites.
Using these words, bro.
And establishing.
I don't know what the fuck that means.
Over the skies we fly over.
Does that mean most of them?
Our forces are executing with unmatched skill, and the mission is advancing decisively. This is the kind of no-nonsense, results-driven warfighting that America demands. And you're delivering it in spades. You are the man for this moment. Admiral Cooper, on behalf of the President, the Department of War, and every American watching, I want to thank you for the outstanding job you and CENTCOM are doing. Keep pressing the fight, and we are with you.
You don't know either,
A few thoughts
buddy.
before I
Do
hand it
you?
over to the Admiral for an update. Iran is hoping that we cannot sustain this, which is a really bad miscalculation for the IRGC in Iran. You see, there's no shortage of American will here.
There's
We
no
remember
shortage.
and honor our fallen.
American
Those citizens we will
badasses.
soon welcome at Dover, who gave everything for their country in this mission. We remember them. But we remember them by rededicating ourselves even more fervently to this mission. Our commitment to our mission objectives only increases as our advantages continue to increase. We've got no shortage of munitions. Our stockpiles of defensive and offensive weapons allow us to sustain this campaign as long as we need to. Again, our munition status only increases as our advantage increases. Our capabilities, we have only just begun to fight, and fight decisively. Having a chance to hear from Admiral
Dude, it's
Cooper.
gonna be like the
Now,
day
if you think
before
you've
the
seen
end of the.
something, just wait.
It's gonna be like the day before the end of this thing, and it's gonna be like we have only begun the fight. Every fucking day, it's only gonna get worse.
The amount of combat
Never
power that's
better,
still
Iran.
flowing, that's
Fuck
still
you.
coming, that we'll be able to project over Iran, is a multiples of what it currently is right now when you add up our capabilities and those of the Israeli Defense Forces. And we have no shortage of authorities. The Admiral knows we have clear objectives with maximum authorities on the battlefield. The dumb, politically correct wars of the past were the opposite of what we're doing here. They had vague objectives with restrictive, minimalist rules of engagement. No more. Our authorities, his authorities, CENTCOM's authorities through the President and myself are maxed out. Our capabilities are overwhelming and gathering still, as are those of our Israeli partners. Our munitions are full up, and our will is ironclad, which means our timeline is ours and ours alone to control. As long as it takes to ensure the United States of America achieves these objectives, and as we flow more forces, and as we flow more capabilities, and as our munitions, as we're flying over the top, have even more devastating effects, we set the tempo, we set the timeline, led by the commander on the ground. Our ear is to the ground to listen to Admiral Cooper, what he needs, and what he needs he will get. We are built for this fight. and we are in it to win it. And we have the right commander in the lead. So I'll now hand it over to Admiral Brad Cooper to give you an update right here from CENTCOM.
Mr. Secretary, first, thank you very much and good afternoon, and welcome to U.S. Central Command Headquarters, America's warfighting headquarters. It's great to be here alongside the Secretary and representing the more than 50,000 men and women in uniform currently executing Operation Epic Fury. So, Mr. Secretary, first, thank you very much for your leadership and support and the very clear vision and objectives that you've given us to allow us to use overwhelming force against the Iranian terrorist regime. And thanks to all of you for attending.
4 stars, Admiral.
We are now starting our 6th day of a historic mission to eliminate Iran's ability to threaten Americans. We are, if I could channel my inner Navy officer, we are at full speed ahead in executing orders given by leadership in Washington. The President and Secretary Hegseth have been crystal clear in their expectations, and we are at a high level of execution. As described by the Secretary and earlier this week by me, U.S. combat power is building as Iranian combat power declines. Our air dominance allows us to hit Iran's center of gravity with overwhelming power and reach. A couple of examples. In just the last 72 hours, America's bomber force struck nearly 200 targets inside of Iran, including Iraq, and in just the last hour, the U.S. B-2 bombers dropped dozens of 2,000-pound penetrator bombs, targeting deep buried ballistic missile launchers. Notably, we've also struck Iran's equivalent of Space Command, which degrades their ability to threaten Americans. Then, if we look back over the last 24 hours of the operation compared to where we were at start, ballistic missile attacks have decreased by 90% since day one. Drone attacks have decreased by 83% since day one. Having said this, we remain vigilant. Our strikes against the Iranian Navy have intensified. You may have heard the President say just a little while ago that we have sunk or destroyed 24 ships. That was true at the moment. We're now up over 30 ships. And in just the last few hours, we hit an Iranian drone carrier ship, roughly the size of a World War II aircraft carrier, and as we speak, it's on fire. The President gave us another task, to raise or level.
Dude, Navy's out there
Iran's
having fun with all their toys.
So we're not just hitting what they have, we're destroying their ability to rebuild. And so as we transition to the next phase of this operation, we will systemically dismantle Iran's missile production capability for the future, and that's absolutely in progress. This is going to take some time, but our forces are well supplied, as the Secretary said, and we are absolutely ready to prosecute this mission decisively. Our combined joint forces
I don't know where he's wearing that shit.
destroyed Iran's air defenses over the past
Maybe because he's at a
days,
joint
and we
command.
continue hunting for more systems to kill. Our air defenders are operating at the very top of their game. I couldn't be prouder, shoulder to shoulder with our partners in the region in many cases, providing the most integrated air defense.
I never wore
network
camouflage in the Navy.
We are fighting to win. Through combined
Seabees
U.S.
would wear
Israeli
it.
combat power, we will continue decimating Iran's ability to project power outside the borders.
Master
And if I
Arms
could
would
just,
wear it.
conclude by saying,
The
I
Shore
love
Patrol would
strong
wear
salute
it.
to the brave men and women who are out on the pointy edge of this, really doing exceptional work. I just couldn't be prouder than I know the American people sharing that same pride. So thank you very much.
And with that, we'll take a few questions. Yeah, right here.
I can't hear you.
We're very familiar with Orion's capabilities, and as you might imagine, we planned for it right from the outset, and I feel good about what the plan was. Like any good organization, we adjust as necessary to meet the environment, and we make those appropriate adjustments.
As CENTCOM pointed out, that those reports of an F-15 being shot down are false.
Oh, really?
As you can imagine,
What?
Iran is doing everything it can to peddle in lies, deception, and inflation.
Oh, they said
Numbers,
another one
reality,
was shot down?
Mostly to propagandize to their own people.
I see.
Right? They don't shut down the internet. They're hoping they can convince their own population that they're having success. One thing one of their leaders said recently is that 500 Americans have been killed with claim. These are lies. The lies will continue. CENTCOM will continue to debunk those lies. So, and as often is the case in conflict, first reports are often wrong. As it pertains to nuclear material and things like that, one of the objectives the president has always said is that Iran will not have nuclear bomb capabilities, but we would never disclose what we will or will not do inside operational plans. So Admiral Cooper's got a plan. We're working that plan, and targets will be struck or not struck according to what we want to achieve. Yeah, very good.
Secretary Hicks, the president said earlier today in an interview that he would like to have a say in who's the next leader of Iran. Is this an expansion of your military objectives? You view it that way? And additionally, you spoke earlier today about how previous leaders have drawn resources from our hemisphere to the Middle East. How do you avoid that?
Well, there's no expansion. Ultimately, I think the president's having a heck of a say in who runs Iran, given the ongoing operation we have. So there's no expansion in our objectives. We know exactly what we're trying to achieve. I think today's a great example of what this War Department is capable of doing. I was just in another part of Florida today where we announced, America's counter cartel conference. 18 countries coming together from Central, South America, and the Caribbean, coming together to fight cartels. That is something that is ongoing. We're focused there. We're focused in the Indo-Pacific. We can mass combat power in CENTCOM. EUCOM is able to support that as well. So we know we're laser focused on our hemisphere and our homeland. That's why we lock down the border. That's why we're working with partners to take on cartels. That's why we're sinking drug boats. That's why we're on the offense. There, the beautiful things about combatant commands is that, Brad Cooper's laser focused on Central Command, just like Frank Donovan is laser focused on Southern Command. We can do both. That's what a global power can do. Ultimately, this issue of Iran's nuclear pursuit and their unwillingness through negotiations to stop it is something President Trump has said for a long time needs to be dealt with. And after 47 years, he's doing something that no other president was willing to do. And we're doing it overwhelmingly, and we're doing it decisively, while also in other parts of the globe having the desired effects. We take, for example, what we displayed yesterday, the Iranian ship in the Indian Ocean, sunk by Indo-PACOM, another combatant command, who coordinated with us in order to make that happen. So America's reach is global. Our focus here, though, these missions are narrow, they're scoped, and Admiral Cooper is well on his way to ensuring that we reach those objectives. Right here, yes, sir.
The Ukrainians talking about providing more cost receptors given their experience. That's something that kind of guys looking for. Can you walk us through a little bit about how effective the Lucas drones have been, what kind of targets they get, and how much that's helped given their low cost alternatives to the more expensive
Sure. I'm not familiar with the particular offer, but the interceptors in general, we've had a number of new capabilities being fielded. Obviously, I'm not going to talk about it from an operational perspective of what those are. But I think you have seen over a period of time us kind of get on the other side of this cost curve on drones in general. If I just walk back a couple of years, you remember what you used to always hear? We're shooting down a $50,000 drone with a $2 million missile. These days, we're spending a lot of time shooting down $100,000 drones with $10,000 weapons from ours. So that's one aspect of it. Lucas, indispensable. As many of you know, and if you don't know, this was an original Iranian drone design. We captured it, pulled the guts out, sent it back to America, put a little Made America on it, brought it back here, and we're shooting at the Iranians. Good targets.
Good targets.
Thank you so much, Secretary. President Trump, in his first speech after the launch of the operation at Fury, he addressed Iranian people and he said that there is going to be a time for you to come out, but it's not now. Stay home. It's not safe. I want to know if there is a timeline for that. That you're going to urge Iranian people to come out. How that is going to play out, and how are you going to protect the protesters? You know that they're going to be shocked probably as these witnesses in January. That's what happened. How are you going to protect and support the protesters? And I have one question for you.
It's simple. Iranians just stay inside from now on forever.
You minimize
Get the Amazon delivery and shit. Pretend COVID's happening.
Evidence that the vaccine units are
Enjoy your new freedom.
They are now gathering in schools, in hospitals, in purely residential areas because their headquarters are bombarded, they are ruined, of course. So how are you going to protect the civilians while you're attacking the IRGC?
I would just say on the protests, obviously a lot of the Iranian people showed a lot of courage in those protests. We saw the Iranian regime was revealed for what it is in the way they reacted to that. The world saw that. No one's done more than President Trump to reopen the opportunity for those who want for Iran to do so. Ultimately, it's common sense, as he said up front. Don't go out and protest while bombs are dropping inside Tehran and elsewhere. So there will come a moment where he determines, or they determine, that it's time to seize that advantage. There's a lot of things we're doing, and the Israeli military is doing, targeting those individuals. We're targeting those who protest. The more you do that, and you erode their will and you erode their capabilities, the more you create an opportunity for people to boldly stand up.
Yeah, I would just reinforce the point. We're targeting the people, or we're targeting the headquarters and the people who are targeting the protesters, first and foremost. I'd also just double down on the president's comments that he previously made to the people. Stay in your homes, keep things calm, stay out of the way. There's a lot of U.S. and Israeli capacity coming over. We're hitting a lot of targets. The best thing for them to do right now is just to wait on. Right here.
One common outcome of American military action in the past has been taking in thousands of refugees into the American homeland, and I'm wondering if there's any safeguards put in place to make sure that the American people aren't having to have another wave of refugees from the Middle East or anywhere else and stay here.
I think it's safe to say there's no plan for a wave of new Middle Eastern refugees to the United States of America. I think, as the president has pointed out for a long time, there are a lot of countries in the region who would be capable of providing that kind of support if need be, but that's certainly not something we're planning on. Yeah, back there.
Yes, sir. Michael in Washington Times. I wanted to ask, I know, semper gumby is always a truism in the military. Did the British decision to refuse Diego Garcia have any impact on the mission itself? Did you have to adjust, or were you able to just completely, go with the mission without having to worry about that?
Well, as the president stated, it was unfortunate that that the Brits didn't, from day one, say, "Hey, go ahead and have access." But we got there. We got there, and that's now part of the way that we're operationalizing bomber runs. And as part of when we say more to come, it's more fighter squadrons, it's more capabilities, it's more defensive capabilities, and it's more bomber pulses more frequently. The amount of firepower over Iran and over Tehran is about to surge dramatically. And part of it is that we're going to have even more basing. And it's not just the UK. We've had other friends step up, and we're grateful for that. Maybe one more right here.
Yeah, the Azeri president earlier today basically authorized the defense to begin preparing troops for some type of retaliatory action at the airport strait. As the Department of War said, CONSPIC working on the inflict the Azeri if they were to move then, or something retaliation.
I'm sure there are plans all at the end to that, but that does allow me to kind of address this idea that the war might be expanding, or there's chaos, and nothing could be further from the truth. If anything, what Iran is doing by targeting allied countries that would otherwise want to stay out of this, they've actually pulled them into the American orbit. So now you've got UAE and Qatar and Bahrain and Saudi and Kuwait and others saying, "Hey, we're with you. We'll shoot with you. We'll fly with you. We'll defend with you. We'll allow you more basing," and other options, a lot of which we can't talk about and won't talk about. But it's actually firming up the unity of the resistance in order to focus exactly where we need to. So this idea that it's expanding or going, no, it's actually simplifying in a number of ways exactly what we need to achieve and how we'll achieve it. I don't know if you
I won't get ahead of policy in terms of what we might do. What I will point out is this is now the 12th country that Iran has attacked. 12 countries, and we're right back to the first point. Those 12 countries are not too happy, and I look forward to working with all the partners who are willing to join us.
I would just close by saying,
Mr. Secretary, one more question. What's your message to Americans who are concerned about security here at home with the change-up that we're going to see at the Department of Homeland Security?
Well, I think Christy Nome did an excellent job over there securing our border and keeping us focused on Rex and the president making a change. We all serve at the pleasure of the president. I'm sure Mark Wayne Mullen will do a fantastic job. He's been a friend of mine for a long time. But Christy did a great job setting us up for success. So I don't have any concerns about whether or not the homeland will be covered down on. And I'll just end by saying I wish every American could get a chance to see what we see. I had a chance to go into the control room, into the Tactical Operations Center, go see these young men and women that are doing this, the dedication that they show at every level, the way they've refined their craft. I've talked to a young colonel who's iterating on how we target and how we find and fix different aspects of what the Iranians are trying to do. They don't know what they're up against. And if they think they've got it solved for, they're wrong. And ultimately, the combination of our ingenuity, the skill, the professionalism, the discipline, and then the sheer weight of the capabilities of the U.S. military, what you're going to see may look routine. You may start to be like, oh, another boat. Oh, another launcher. Oh, another drone facility. What it takes to do this with the precision that we do is world-class. No one else can do it. And it's world-class Americans. Like the ones I saw here, like the ones that are coming home, that we're going to greet home, that are the engine of what makes our country great. And so I'm so grateful for folks like those here at CENTCOM and Central Command who are under your command. Thank you for your decisive leadership. And all I'll say to you is what I say to them, keep going. Because the President and myself, we have your back. Thank you, Admiral. Appreciate it very much.
Mr. Secretary, how is this operation going to ensure Iran never gets a nuclear weapon?
Anything to add?
Yeah, Admiral.
All right, guys.
Hey, you. Who's your dad? Simon's respiration is 31 right now. Oh, this is good. Cats with heart disease often have eyes open during light sleep.
Truest sleep is judged more by relaxed posture, no sudden movements, and quiet breathing. So I guess that's his resting respiration rate then. That's fine baseline. Pontiac. I think it's time for lunch. Sounds like it's ready. 2 girls found in a suitcase. Woman arrested, expected to be charged later today. Gotta eat, buddy. Gotta go. Go, 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 go.
No, not my chair.
Alright.
Move again.
The shocking truth about the pizza monster. Okay, now I got a movie again. Come here. No, I know you want some pizza too.
Here, you can have this instead. King of the Mountain status. Anything happening, dude? Oh wait, did this thing get done? Tell me what it needed. Okay, it looks like right now 31, he had a 31 respiration. While lying on his back with eyes open and appearing asleep, looks like improvement. It suggests he's currently stable, not in crisis. Keep monitoring respiration rate over the next hours and sleep cycles and mention this pattern. Okay, we're mentioning everything. I'm just gonna write an essay for the vet before I go. He better read it because I'm going to test him on it. And if he doesn't, I'm going to Yelp review him into hell. Whoa, loose boat. Wow.
New details now about this shocking scene on the 91 freeway. A boat trailer coming loose on Sunday, jumping the median into oncoming traffic. Tonight we're hearing from a driver who narrowly missed it.
Oh shit. Wait, oh shit, it went over the median. They said that, but I didn't believe it.
Mark, there's a saying that goes, a smooth sea never made for a skillful sailor. And that same principle about navigating obstacles is now being applied to defensive driving here as this woman tonight counts her blessings.
I'm driving and I'm looking and I'm like, there's an expletive boat.
Mayday on the 91 freeway as a loose boat sails across the median.
I had seconds.
Dude, I think she got really fucking lucky there wasn't a car to the right of her because she would have probably hit it.
To respond. I mean, it was surreal.
Cassandra Sorrell, thankful she's alive. Her Tesla cameras capturing the heart-stopping moment she narrowly misses the boat. Sunday around 5:30 as she traveled westbound on the 91 in Bellflower.
I braced myself very, very tightly for impact. I was certain I was going to hit the boat.
Another car capturing the runaway vessel seconds prior, crossing 3 lanes of the eastbound 91 after becoming unhitched from a vehicle. The CHP shutting down the freeway for several hours, leaving drivers in disbelief.
A boat is on the freeway and fell. That's what's holding up the whole 91 freeway, guys.
Sorrell says she suffered whiplash and her Tesla is now slightly damaged.
Whiplash?
Tonight she's hoping the ship hasn't sailed on finding the person responsible.
Bullshit.
What I understand from the CHP is that they contacted the registered owner of
From
the
what?
boat.
Steering?
And the registered owner is claiming that they sold the boat and they don't know who they sold the boat to. I mean, that's a little fishy.
Oh shit.
You know, help us find who was driving.
This certainly could have been a lot worse, and tonight the CHP is investigating this incident, trying to locate the person and driver responsible, asking any other drivers who may have video footage of this incident to please let authorities know. Reporting live tonight, I'm Michelle Fisher, ABC 7 Eyewitness News.
Was it them? You guys, we had a flare over here. We got a flare up. It just burned out. We had a flare.
I'm checking for other updates here. Some of our viewers said CNN had some report about something or other. Our viewers were mentioning this. I'm going to check that out.
Our viewers. Who? Wait. There's somebody else's viewers? Are they viewing each other? Are viewers viewing each other?
What is the report people talking about?
Well, that's right, huh? You got to do all that, like reporting a car. You have to, like, this seller has to report it to. I can't remember. I think the buyer only reports it, right?
Ship striking the Iris Dana with a devastating.
Boom. Look at this couple. Isn't that nice? Well, he looks super happy. He looks looking like the SSRI eyes.
looks crazy.
They had rescued a bunch of people too from that ship. Chat shut down.
What's going on out here?
We just getting started. This thing over here shutting down.
Is that the same clock that? No, it's
Details
different.
now about it.
They both have one though. Yeah, your ears feel pretty quiet right now.
The USB cable, what it is. Okay, I'll fix it in a little bit. We'll fix it. Live updates. House joins Senate in rejecting resolution to halt Trump's attack on Iran. Yo, what the hell? You heard that?
That's the second one. Another one happened while I was talking.
Holy moly. Oh, that's crazy to just hear those explosions like that. Let me just replug this. I want to be able to see the chat.
Gagged, baby. Whoa, is this real? Let's see. India billionaire mansion atop skyscraper. Wow.
Oh, is that it? Or hard to even tell. Smoke everywhere. I don't like this thing's gonna be over anytime soon, this war. Florida, you talking about Miami? Newberry, Florida. Where's Newberry, Florida? Not far. Come on. There we go. Alright, let's keep seeing what else is going on. What else is popping? Israeli airstrike reportedly have struck El Mashifa in Beirut. See what's going on with CNN, because I heard they went into Iran. I don't know if they're going to make it back out. What the heck?
Really?
Go where it's inside of Iran.
We're making fairly good progress towards Tehran. It is a very, very long drive, though. Some things that we are seeing, we already went past one place where apparently there had just been an airstrike. There was thick black smoke billowing over one place, so it seemed like a fairly fresh airstrike. Also some destroyed buildings that we saw from our vantage point as we were driving past. The other thing that I would also say is that there are definitely more checkpoints than usual. We did see checkpoints with fairly heavily armed security personnel. Other than that, though, it seems as though things are going on, and we certainly don't see any sign of order collapsing here.
Taking a quick break for a coffee along the way. We've been driving for several hours. There's a couple of things that we've noticed. Number one is that, first of all the shops are open. All the shops are really well stocked, even with fresh things, like, for instance, fruits and vegetables.
They got the Jack Daniels?
Coffee, obviously, also available as well. And then also the gas stations. There's no long lines as gas stations. Fuel seems readily available, and you just
They have water.
don't see any sort of degree of panic anywhere.
Better than Gaza. Better with the oat.
I did have a video from this.
Do you think they have the Quaker oats?
Yeah, if I can find it. She was like a resident.
The Quakers. Were the Quakers there?
Well, I'm trying to think of what I'm thinking of, because there was one lady, she said, yeah, I'm in Iran.
That's a pretty fucking telltale sign.
Post, and she's like, I'm in Iran.
That the Quakers have been there. They have the oats. That's how I know. That's what I look for. I look for those fucking oats. Those motherfucking oats. With 2 motherfucking peppers. That's how I know. How do you know? How do you guys know? Put in the comments below how you know. No. No. It's my seat. You come there. No. No. Oh, I almost fell over. Oh my goodness. Look what I got. I got killers. Look what I woke Simon up, kinda. I think he's eating now. So, what's it do? You know what? Ow! Ooh, you fucked the fuck up, boy. You using the claws against me? You want me to get some? Do I need to clip these? Nah, let me look at what you got going on here. Oh, motherfucker. Yo, I've been letting you have a little too much power in here, it seems. What else you got going on? Huh? What are these looking like?
Right. Oh man. What? Ow. I barely fucking see him because of all his fur. But that shit's sharp. You can't go. I got you. Oh, hey. You wanna go? You wanna go down? Okay. Slaving the day away. We got Sweet Pea down here, straight chilling. Super slow respiration. See where she's at. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 and a half, so 23 respirations per minute. Doing great. She's doing great. Just recently started using that cat bed. I got it for Simon, but he just doesn't use it, so I brought it in here. Thankfully, she's using it. She's the only one that'll use it now. I think it makes her feel more safe, secure from Sawyer. This high sides like that. A little more protection, maybe. Simon's shotgun eating. He's right there. Hey, buddy, what you doing? Simon. Simon. You want to come in here and look outside? Come here. Simon. Over here. Over here. Three cats, one room. My buddy, my Simon. I guess I need to go divvy out a little more food for him. I should count his respiration again. Oh, why you gotta fuck with him, Sawyer? Son, come here. I'm sorry, dude. I keep following him, Sawyer. You can't ever come in here without Sawyer. I was gonna lay over here.
chili burger. Can't see it. Oh, hell no, I don't have it on the right. Still can't see him. Now it's hard for me to see his respiration. Best life. Simon. He's not quite sleeping, he's kind of acting weird. Acting weird. There he goes. I can't see his respiration over here though. Dude, I don't know if I just got 19 or if I'm seeing shit. I can't. It's so hard to tell. I'm just trying to count his respiration.
no sound. I'm getting 40 right now, total. Not good. I don't think this is a good position for him. He's sleeping in. Not sleeping. Breathing really fast in that position. Oh, Sawyer's right there though, close to him. On the other side of the camera. Sawyer, stop. Dude, that's so fucking loud. What the hell? It's not like a volume control, man. It's only on or off. Alright, I turned it down. I got fucking scared Simon. I had like over 40 right there. Oh, lethargy. Yawning. Yawning with increased respiration is kind of weird. Thirsty Thursdays. Everybody thirsty, right? Be sure to drink your water. Ah, delicious. tricked me. Shoplifters caught after stealing 17 times at the same Walmart. Fucking stupid. What did they think? That like they were just so damn smart. The odds of you getting caught go up every time you steal from the same place, doesn't it? It's like having unprotected sex. The odds go up, you get an STD every time you do it. And it's just common fucking sense, you dummies. They should have switched it up probably. Amazon employee steals, already told us about that one. Amazon employee steals your soul. Amazon employee is working for the devil. Oh my god, this is getting out of hand. All of Africa, nothing's happening. Can you believe it? Was it time to count it again, Simon? Let's see what we got here. Those look pretty fast. Well, I can't count it yet. Uh-oh. Hey, Sawyer. Sawyer, what are you doing? Why are you fucking with her? Why you gotta fuck with her, huh? Are you just bored? You're just so bored, huh? Oh shit, I forgot I was doing that. Sorry, Simon. Alright, glad I turned it down. Shit, I woke Simon up again. That doesn't help things. At least his pupils aren't blasted. Or no, it would be the opposite, wouldn't it? It's no, it would be blasted. Let me ask the bot. What are the effects on the iris from high or low blood pressure and cat? Blah, 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 blah. That's what's happening. Got a fingernail here that I need to clip off. Holy shit. Holy shit. Subtle. Oh, you can't see at home without an exam. So that's probably why he looked at his eyes. Check his blood pressure. Not even blood vessels in the iris can swell or dilate in the form of small aneurysms, weak bulges spots, and some hypertensive cats. These usually require a slit lamp whose hand to see. Bleeding in the eye, correct visual, eye structure, blood can leak in the eye, causing You generally kind of see true iris changes at home without a vet exam. The clinical clues are sudden blindness, squinting, red or cloudy eye, obviously dilated pupils. Oh, low blood pressure, shock or sedation, overly strong heart meds affect the whole eye. And circulation, not the iris in a specific visible pattern. Poor perfusion of the eye. Very low blood pressure can cause pale, dull, or dry-looking eyes and weak pulses, including in the eye vessels, but this is usually spotted on exam, not via iris color alone. If low blood pressure requires shock or severe heart failure, you see cool extremities, weak pulses, pale gums, lethargy, low body temperature, possible abnormal breathing long before the iris shows clear sign. Oh. Oh. Okay. Respiration rate's more important. Let's try it again. Try to see what we got here. He's laying his head down. Oh man, my shit just glitched out. Alright. I can't hear it now. Let's try it again. Damn, so 19 and a half, damn it, 39, it's almost time for Plavix. Kitty, 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 kitty.
I'm gonna end this one, y'all. Key stream out. Thank y'all for hanging out. Simon says bye. Do other stuff for a little while. Thanks again. Bloop bloop. Out of here. We're gonna out of here, bruh.